Hello, hello,
Hello.
hello. You can go ahead.
Oh, I didn't know who was driving this
We didn't
thing.
talk
I
about it
just assumed it
beforehand.
was me. Welcome everybody to the Transatlantic Call-In Show, the show on the internet where you can, as it says, heal your trans derangement. This is the one place where we offer treatment to heal your trans derangement syndrome, which is officially in the our very special secret ICD 11 and DSM 27 that I found out about from an angel in the woods somewhere. They gave me some plates that were silver, and that's how I found all that information out. But if you want to know how you can treat your trans derangement syndrome, or if you want to tell us that puberty blockers are bad, or if they children shouldn't have access to them, any of that stuff, if you want to debate us on trans issues, call in. The number is at the bottom of your screen. And if you are outside of the continental Americas, you can use the web call-in studio. There are also two streams going on at the same time. There's one in horizontal and there's one in vertical for those people watching on their phones. Both are great. There are separate chats for both of those. So if you really want to give super chats in both chats, you can. You can also give super chats in either one.
You should at least
And you
like
can,
on both streams.
you
Push
should,
it
you
out to the
should.
algorithm. It's free, it's quick, it's easy. Just do it real fast.
Yes, yes, definitely. Like, comment, subscribe, all the things that helps us get out everywhere. And if you want to vote for your favorite or least favorite host of the day, you can send a super chat of $5 or more, and the loser of the vote. So if you put hashtag Team Ben, hashtag Team Lux, whoever loses has to defend a silly position that you will vote on at the end of the stream. So stay tuned for that. Get your votes in. No hashtag, no vote has to have the hashtag in it. So, Lux, how have you been this
I'm
crazy week?
doing so well. I've been completely off the internet pretty much. And so people were like, "Did you hear about?" And I'm like, "No, I didn't." "Did you hear about?" "No, not really." Um, which is not the best for my job. I need to like reincorporate it in just like tiny bite-sized pieces. I think I need a work phone so that I can have like threads and all the apps, but on a device that I keep locked in a drawer for 23 hours a day. Because I had to remove all of it from my phone. Like I just can't, there's too much information all the time and it's overwhelming. So, I'm just like, I got a new fitness watch so that I can track my heart rate and get sleep information. Uh, Apparently I don't get enough REM sleep is what I've learned about last night. Yeah, so we're just trying to make it through day by day. I'm wanting some people with trans derangement syndrome to call in so that we can pray for your healing. We'll do it together. We'll pray the derangement away or
Yes,
something along those lines.
and while Lux has been decreasing the amount of stressful news exposure, I decided to make a TikTok not too long ago,
Hmm.
finally. So if you want to follow me over there, you can, because eventually, when I have some free time and I'm able to do like I can do lives, but I don't think I can do the lives where people can join in. I want to debate some chiropractors over there, so stuff's gonna hopefully gear up. But I want to go antagonize some alternative medicine people.
That's
So
fun.
my mental health has uh, maybe gotten a little worse in thinking about that, but I think it'd be fun. I think it'd be fun poking at that.
I agree that
What do
it's
you
fun.
what do you think about getting into last week's poll?
Let's talk about it. Yes. I was here for this one, so I mostly am interested in your thoughts. Yeah, do you think TACIS will be targeted by the administration's focus on violent left-wing transgender extremists? You saw the news, I am assuming.
I did, yeah. Um, so I mean, my thoughts is like, yes, I think I mean I think they could under the framework that they are setting up. I just have so many questions about how much of a focus is like specifically targeting organizations going to be, and like which organizations are they going to target? Because we know that they're targeting very, very big mainstream media organizations. It seems like some of
Totally.
the biggest hit for that.
The
I
Jimmies.
guess the question is, how high up are we on that list? And that's I know it depends on how many people they actually have staff for doing that and how much effort they're putting into that. And I think of a lot of questions. So I mean, my answer would be theoretically yes, but um, how successful will they be in doing that?
That's the question. I mean, they've been kicking this around. We saw the leaked memo last year, I think more than 6 months ago. So it's like they've been kicking this idea around the office for a while. And there was like that brief sort of discussion about like trans people shouldn't have guns that the NRA even was like, no, no, no. So, and I know we as an organization, we really try to be, we encourage people to vote. We encourage people to peacefully protest. We repeatedly denounce violence and we don't celebrate violence. So I'm like, I kind of feel like we are, because we tread so safely anyway, like, I think even if we didn't have all this pressure from the government, the line as an organization would still be very much like, we're not trying to promote people breaking shit, broadly speaking. So I just feel generally like we're gonna be okay, but maybe that's the normalcy bias hitting me and my need to feel safe. Um, and we're led by a white man. He's the owner of the company, so I kind of sometimes I'm just like, don't notice me, don't notice me.
Yeah.
But we will see what happens in the next 2.5 years, or is it
Mhm.
3? I'm like, how much longer? Count the days down. I'll put a thing on my phone that's like days counting down until he's at least out of office.
Theoretically, well, we'll see
Theoretically.
about those other plans that he has, but
Yeah, they are
um,
trying to get a majority so that they can make changes to the Constitution, it seems. So,
yeah.
yay.
Lots of fun stuff going on. But
Yeah.
let's just see what this week's poll is, and then you all can vote before we discuss it later. Are tanning beds safer than puberty blockers for minors? Yes, no, or I'm mad there's not a third option. Take your pick, and we'll discuss this one later. It is a wild story. Um,
Excited to get
so
into it.
give us your answers. All right, we've got some callers coming in. Want to
Ooh.
jump into this first one that's ready?
Yeah, we do still have open lines, y'all. So don't forget, real quick, if you hit the like button, that'll boost us to the algorithm, get more people. If I see you in the vertical stream talking shit, I'm going to invite you to call because I'd love to have a conversation. Number is 720-619-2288. Arden, the automatic thing has not been fixed. So the number on the screen is wrong. You'll have to put in the custom number and fix the nines
Oh, yep.
to eights.
Thanks.
Yep. I keep telling, I'm like, hey, Jimmy. And he's like, I'll fix it when I get home. And then guess what doesn't happen? I appreciate all the tools he's building for us. But yes, let's get into some calls. Let's do it.
All right, we're going to talk with Jack, they, them from Scotland. It goes through. Jack, you are live on the line with Dr. Ben and Lux. What would you like to talk about?
Yeah, so I've got a bit of a stranger topic. So recently I started reconnecting with people from that I had like met during high school, and they'd essentially brought to my attention a lot of like really bad behaviors and practices that I had like essentially like just generally shitty behavior towards them because they are like trans or in some way queer, have queer identities. And since then, I have came out as non-binary myself. So it's like, what sort of ways could someone potentially show that they want to take some form of accountability? And I understand I'm not speaking to monoliths of the community, but like, what sort of things would show that there is an attempt to take that accountability? Because when I say it was pretty shitty behavior, it was pretty heinous. When they were explaining it back to me, some of the things that I'd done and said, it was really bad.
I mean, I mean, wear a pronoun badge is a passive thing that you can do to be like, I'm an ally now. Or like just the progress pride flag pin. I see a lot of people wearing that. Like, I walk in circles that are not queer exclusive, like the Renaissance Festival. And it was very common for people to just be handing out like ally flag pins, basically, for people to wear on their garb. It's kind of like flair a little bit.
Mhm.
You collect flair a little bit at the Ren Fair. Um, So I mean, that's like a just like a passive, quiet move that you can make that could invite conversations and make people feel broadly safer in your presence. Other than that, it's just like repeatedly demonstrating allyship in conversation, basically. I don't know if you wanted to add anything, Ben.
Yeah, that's kind of what I was getting at. Like, there's definitely those passive options. If you're thinking about, maybe rectifying some things that you've done in the past, if there's anybody in particular that you've hurt or you've said things to, it might be worth, if you still know them, to just reach out and say, hey, I acknowledge that this thing that happened in the past was not cool, and I'm sorry I did that to you. Not everybody will appreciate that, but, it's something and might open the door for them not hating you so much. Uh, and yeah, other things, if you're gonna, like, you can go to Pride events, you can show your support, you can donate to organizations, you can um, like hold signs at different protests and things. I think showing active participation, even if you're not in the community, but standing beside them, I think that would be helpful as well.
Okay, no, that absolutely makes sense. I have some of those I do already participate in. I've got a pronoun. I wear a hat that says "Please be patient. I have autism." I've had this hat for like 9 years now, and I've got like two little pins on it. One with the non-binary flag, and then one with like they/them pronouns on it. Some of these I already do, but absolutely, I think you're definitely correct in saying that maybe reaching out and doing it more as a interpersonal thing would be the correct move.
Anything else you want to mention about this? Any other questions that you have?
Most questions I have usually end up getting answered during the more debate focused things. So anything I'd ask would just end up being a broken record later, and nothing comes to mind right now. And I'd also seen in the chat, because I'm also watching live in the stream. I do see that people are also saying things like, for example, like people might not necessarily feel comfortable accepting apologies and stuff, which is absolutely valid. Again, the things I've done, I understand that they have an impact. The things I've done, the things that I've said, and to just expect that to go away because I said, "Oh, I'm sorry, I'm queer now," would be very silly, and it is absolutely valid for people to never even potentially forgive me. So like, it was just wanting to get that step in the right direction of like knowing what's the first thing to do, because when it comes to any sort of interaction, I'm very clueless with it. So it is like, I appreciate that even just going, hey, this is the correct direction that you should start going in. I appreciate that as an answer.
Awesome.
Cool.
Well, thank you for your call. I hope we continue to answer your questions throughout the stream. I hope you stick around to listen.
Oh, I will do. Thank you very much for the help, as simple as it was to give. Thank you.
Yeah. Thanks, Jack. We appreciate you.
Have a great day.
Have a great night.
All right, we got a
lines are filling up today. Yeah.
You wanna take the one I'm thinking about?
Yeah, let's go.
All right, we're gonna talk with John, he, him, from Arizona. John, you are live on the line with Dr. Ben and Lux. What would you like to talk about today?
Yeah, I don't think gender is a social construct.
Okay. Elaborate, please.
Neither is race. Yeah, look, this is all my personal opinion. I guess maybe the way I'm defining a social construct, and maybe this is where the disagreement is I think of a social construct as something that just people make up with no basis in physical or biological reality. And because the basis of gender is anatomy, that's why I don't think that gender is a social construct. Like I said, this is all my personal opinion. Do you have a different definition of what a social construct is?
Yeah, so my pushback on this would be that how do you think, with regard to gender, how do you think people interact with each other based on anatomy? Do you think it's always based on anatomy, or do you think there are other factors that play into this as well?
And there are rare exceptions of intersex, and certainly
But
I've
not even
debated
with
a
related
lot of
to not even related to intersex, but just think about how I'm assuming you engage with society as a man. So do you think that society knows what anatomy you have, or do you think there are other factors that play into how you interact with people around you?
the primary factor is anatomy. But yeah, I mean, I've debated a lot of people on the left, and my understanding is, and you can tell me if I'm mistaken, is that on the left, it's more of a, of a brain function, like neurobiology, the way people want to identify it, where I think anatomy is the primary.
Wait, do you
Okay,
think
which
the brain
anatomy?
is not part of the anatomy right now? Like, do you think the brain is an irrelevant aspect of your anatomy? Because if it's neurobiology, then it's anatomical.
Just mean anatomy in terms of uh, uh when I was born, the doctor said it's a boy.
Okay, but what do you
I have
mean?
a I have
Be specific.
it means I have a I mean I have a Johnson. This is a
John,
very go ahead.
if so here's the issue. So if you go to the store and you buy some items and you talk to the cashier and they say have a good day, sir. Do you think they are calling you sir because they know you have a penis? Or do you think that there are other factors that play into why they call you that?
I think that was the case until about the last 10 years or so ago, where this pronoun
What if
phenomenon,
what
and
if
there's
you were
a
in the army and you got your pee-pee blown off?
I was I was born male because I was
Yeah,
born
but
with
okay, yeah,
with
but do you
male
think
anatomy.
that people are
Johnson.
going to like stop calling you sir if you get your pee-pee blown off? And do you think that this is a new phenomenon that only happened in the last 5 years? Or do you think that maybe in like the 1950s, if a man got his pee-pee blown off in the war, people would not be using his pee-pee as a way to define whether they think he's a man or not? Like, do you think maybe it has something? Do you think maybe there could be literally anything else going on besides because nobody's looking in your pants? I hope hope that nobody's doing that to you at the grocery store.
Well, this is what I'm trying to talk about. This really wasn't an issue until about 10 or we didn't talk with pronouns. With nobody ever asked me, like, we didn't talk this way. It was just assumed that
Right,
people presented themselves where it really
but the
wasn't.
assumption,
Go ahead.
where does that assumption come from? How do people make those assumptions about what your gender is?
It's based on physical appearance, like for example, facial hair and short
Okay.
hair, and or as opposed to long hair and makeup, and I'm just now in our time
So
now
are you
the
born?
lines are
So are
blurred,
you
and this is
born
a
with long
well,
hair? Are you born with short hair? Like, can boys grow out their hair? Can boys, if a boy wore makeup, does that mean he's no longer a boy?
no, certainly there have been men in the past who've had long hair, like, but the point
So
is
aren't
what the
those,
left is
so
intentionally.
aren't those, so aren't those social factors? Those are social things that we assign to gender to then make decisions about how we treat people.
I'm just saying it's that there's a what the left is trying to do is they're trying to make gender and sexuality fluid. This is the goal of the queer theorists, like Judith Butler
It's not a
and Gail
goal, John.
Rubin,
It's
and
it's John. Maybe there's a misunderstanding that is happening here because what we're doing is descriptive, not prescriptive. We're not saying gender and sexuality should be fluid. We are saying objectively they are fluid. That's an observation that we make scientifically, that it changes over time. Like here, I want to get your thoughts on this. Would you say it's the peak of masculinity to wear a wig and tights and to faint?
peak of masculinity to wear wig and
Yeah.
tights and faint. Well, I
Yeah.
don't know if you in Shakespeare's time maybe, but
When this
not
country
now.
was founded, as a matter of fact, those were like high status masculine symbols. To wear high heels was a high status masculine symbol. So, what does that like? The fact that it's so dramatically different now that now you would probably agree that masculinity is like having big muscles and dirty hands and working a hard job. So that is a social thing about men that has changed over time and is kind of irrespective of their genitals.
Just trying to articulate that I do believe there's a genetic component, but there's also an environmental and cultural aspect of people becoming gay or trans. And there's an exponential increase in the last few years because the left glamorizes it. I don't know if you're familiar with the
John,
work
you're
by Abigail
changing the
Shrier.
topic entirely.
You're
changing
dodging
the
and
topic
weaving.
entirely.
You cannot
So we're
take
talking
the points
about-
and you're dodging and weaving.
Yeah, John, we're talking about if gender is a social construct. That's where the discussion is right now. So let's keep it right here before you go into a whole separate discussion about genetic components of queer identity. So what we're getting at with this whole conversation is that there are social factors that influence how people interact as their gender. So we're not denying that there are biological components to people's anatomy, and that oftentimes these coincide with how you engage with society, but these are kind of separate things. And so that's why when we say it's a social construct, it's not saying that biology never had anything to do with it. It's just how we relate to each other, like we were mentioning, is you're not at the store getting your junk looked at to make sure you're getting the right pronouns. There are other things that are often set by our society. Even if you look at long hair versus short hair in men, let's even go back to the times of the Bible, right? Like short hair was like something that the Romans did pretty frequently, but the people in Judea wouldn't have done that. So are they more or less men for being Roman than being from like the nation of Judea? So like, what would you say about that?
No, I mean there's certainly men can wear their hair long. It's just generally speaking that if it would be less confusing for somebody unless they were intentionally trying for people to be confused about what their gender actually is, would just be an easier way to define that would.
But you notice we don't really, the way we define masculinity and femininity is different across different cultures, and that was the point that I was making. So if each culture is going to have a different set standard, then it's really, if let's say if I showed up to a country where actually men do wear skirts, like countries that wear kilts, you'd be more seen as masculine there than if you wore a skirt here in this country. But that doesn't have really anything to do with what's in your pants, right? So that's just how we interact with each other, and that's what we mean. How these are separate.
Right. So I mean the definition I gave of social construct, was that reasonable to you?
No, not at all. Not at all.
It's not reasonable.
Like no,
so
like the concept of value, is objective, but we created money as a social construct to establish and exchange value, right? So like money is a social construct and grounded in something that is, we would describe as like something that objectively exists. Like gold is more valuable than lead because it has better properties and there's less of it, right? So gender is a social construct because we have created enormous social mechanisms surrounding what we believe about the biology, right? Because you've mentioned intersex and you've hand waved it away as like a rare anomaly, even though it represents like at least the entire population of the country of Canada. Like that, it's like there is an enormous social thing, so much that we alter the healthy genitals of babies to normalize them into our gender construct. So yeah, I think that your definition of social construct is deeply, deeply out of touch with reality.
Okay, so a social construct is it's something people make up. But you're acknowledging that there is a physical and biological aspect.
Let's touch on race for a second, because you brought that up as an example earlier. So there are ethnicities which like, okay, like an Ashkenazi Jewish person or folks from different parts of Africa have like different, medical issues, right? Like Dr. Ben can confirm like certain medical issues are experienced by certain ethnicities at different rates, like sickle cell anemia or BRCA2, breast cancer and whatever. They happen to different groups. But then we have race, which tries kind of to build on the fact of biological ethnicity, but lumps them in categories that are unhelpful, that end up erasing the difference between ethnicities. Race is a social construct it's basically taking some physical differences that we can observe objectively and lumping them together in ways that create social hierarchies. That's what that's one of the things that a social construct can do, is like create strata, basically social strata or social castes in society, distinguishing who's allowed to do what. And yeah, just because it's a social construct doesn't mean that it is ungrounded in reality or that it is not deeply impactful on people's lives.
Okay, yeah, race is not a social construct either. Race is an attempt to simplify ethnicity, and it makes sense,
I love how you
right?
didn't listen to anything I just said.
no.
Did you know that there was an Asian man who
disagree
sued
with
to
you.
be considered? Did you know that there was an Asian man who sued to be considered white in this country's history because he was a landowner? Like, did you know that Irish people and Italian people used to not be considered white? Like during Jim Crow segregation, there would be a sign outside the bar that said no Italians, no Irish, no blacks. So that's not useful to flatten all of these different people into one group. Like it's not useful unless you want to establish a power dynamic. And then it's super useful because then you can lump all the Irish people in with the whites, and now Irish people no longer have racial solidarity with black people or like oppressive solidarity with black people. It is 100% a social hierarchy system.
Okay, so maybe if I could just talk and not be interrupted for about 30 seconds.
Nope.
The
more you cry about it, the more I'm going to interrupt you.
Well, maybe I should just end the call then, because it's not a fair discussion. It's
You're
really
an obvious troll, so I don't know why I would take you seriously.
Not trolling. I'm not trolling. I think the left is insane, and y'all are destroying Western civilization. I'm not trolling.
Why are you trying to have a rational conversation with people you think are insane? And why do you think I would allow you to continue if, like, I know that you're treating me like an insane person? Why do you think that's a good faith conversation?
I haven't been disrespectful in any way. I'm talking very calmly. I just like an opportunity.
Just because you're calm doesn't mean that you're not being rude. I want to be clear. Just because you're speaking calmly doesn't mean that you aren't being rude. You just called us insane. That's rude.
Well,
it's so crazy how often I have to explain basic kindergarten concepts, like how to not be rude to someone when you're having a conversation on this show. It's wild. It's genuinely
because I disagree with you.
You called us insane. That's not a matter of disagreement.
You called us insane.
That's pathologizing.
Gender dysphoria is a mental illness.
So was being gay. Do you think gay people are insane? You dumb fucking moron. Oh my God.
Well, that's just ad hominem. Look, I know how.
It's not an ad hominem. I'm saying you're wrong and you're fucking stupid. Not you're wrong because you're fucking stupid. There's a difference. Learn how to use fallacies. Oh my God. This is hilarious, dude.
Well, I mean, the average IQ of American black people is an 85. For East Asians,
IQ is pseudoscience, you dumb fucking moron.
Yeah. All right. And with that, we're moving on. We're not doing that. Yeah, IQ is absolutely pseudoscience. And
what a racist piece of shit.
Yeah.
Yeah, that's always fun.
Like people who do not understand that, like, sure, we've assigned meaning to very specific physical differences between people, but like the amount of genetic differences between people of a certain race is more significant than the similarities between people of different races. So like this is all absolute BS.
Yeah, it's really dumb. Man, is there somebody out there who can make this argument better than John could? Who had more than nah? Does somebody else in the look, is there somebody in the live chat who wants to we've got open lines, 720-619-2288. It's super easy. We're generally really cool. I'm like, I gave that guy 12 minutes of like bad faith conversation before I finally started calling him out on it. So listen, if you want to come in and make the arguments, we are prepared. We have the facts. Like Dr. Ben is a medical doctor, right? Like we've got the information, we've got the expertise. And if you just come in and you say like, well, my opinion is that you're insane, obviously I'm not going to continue a respectful conversation. But we still have open lines. If y'all want to come make the argument, if you hadn't hit the like button yet, then do it. It's quick, it's easy. You know, just go beep beep, hit the like button, double tap on your screen, and that'll help us get more, hopefully better callers than that.
Yeah, for sure. Do you want to do one more and then the poll, or poll and then more calls?
Let's give it a minute for some not advice calls to come in. We've got a couple advice calls. We'll get to those a little bit later, but let's give folks a minute to call in and talk about the poll.
So let's do the poll then. All right, this is a fun one. So, are tanning beds safer than puberty blockers for minors? And so far in the poll, we see 3% of people said yes, 80% of people said no, and 16% said, I'm mad there's no third option. So
we got to represent you contrarians.
Yeah. Lux, did you hear about this particular headline? Because it was fun.
Only the fact that you posted it in the chat. That's all I saw. So like RFK Jr. said that tanning beds are safe, but did he directly make the comparison to puberty blockers, or is he just simultaneously saying two different things?
No. So here's what he did. So he decided to so I guess some more context. Tanning beds and tanning salons have an age limit, and teenagers are not allowed, like minors are not allowed to go use tanning beds. However, RFK Jr. has decided that we should drop the age restriction for teenagers and they should be allowed to use tanning beds because for some reason, teenagers have the ability to have bodily autonomy in terms of skin cancer risk, but they don't have the bodily autonomy for puberty blockers or top surgery or HRT. So it just seemed like a bit of hypocrisy that was absolutely great because the medical consensus is united on the fact that tanning beds cause cancer. Like we have an actual causal relationship demonstrated between ultraviolet radiation and skin cancer. And the medical consensus on the other side is overwhelmingly in favor of gender-affirming care for minors when used safely and under the current recommendations. So advocating for more harm to come to minors and not allowing them to get evidence-based treatment for gender dysphoria.
Yeah, that's wild. That's so silly. Like that we have, and it's because people are always like, oh my God, they're so harmful. And it's like, what is more harmful than skin cancer, you guys? Dr. Ben knows this. Skin cancer metastasizes so fast. Like it's genuinely like you don't wait 6 weeks when you're like, I think that I have a mole that's getting weird. You get an appointment today and they rush you through because even if it's not something, they want to evaluate it quickly because skin cancer, like it burrows down into the lower layers of tissue and then it spreads through your bloodstream and it just very quickly becomes like a full body problem. So it's crazy that something that is so rapidly an issue, like you have to get it removed immediately. Like that they're like, yeah, no, that's fine. Go sit in a tanning bed with your child brain that probably like teenagers don't understand moderation. They don't like physically have the ability to stop themselves sometimes when they're the ability to envision that things will be different later. They're like not necessarily correlating the massive amount of time that, let me just get the maximum results from this tanning bed and stay in for longer than I should. Meanwhile, like puberty blockers are a slow, conservative treatment that you can only use for 2 years, and then you have to make a different medical decision. And for so many different doctors and professionals to be involved with the decision-making process of putting a child on puberty blockers versus the zero. I mean, I've never done a tanning bed myself, so I don't know. Is it like a cosmetology thing where somebody has to have a certificate of some kind on the wall?
I have no idea how they're regulated, but there is zero medical benefit to any tanning bed. Like
Yeah.
zero. In fact, it is just harm. So like
Only bad
adults can make
things.
their own decisions about that, but why are we going to allow
And it's purely
minors to do that?
cosmetic.
Yeah.
Like it's
Yeah, and it's
strictly
purely
cosmetic. Where I'm like, I'm having arguments with people almost every day right now where I'm like, okay, what medical training do you have that indicates that trans healthcare is cosmetic and not medically necessary, which almost every major medical organization agrees it's medically necessary care versus fucking tanning beds. Oh God, I'm gonna lose it. I'm gonna lose it,
But
actually.
we're making America healthy again,
We're making
right?
America
With
healthy again
tanning
by giving them
beds.
skin cancer. Yes.
Right. And you know what is better for reducing healthcare costs on a national level? Definitely the thing reducing costs is giving everybody cancer and having them have to get surgeries and chemo and like all this other stuff.
I bet that's great for the economy.
Yeah, that's great for the economy instead of, preventing hospitalizations from giving appropriate gender affirming care.
Yeah, that's
But
crazy.
what do I know?
Yeah, what do I know? I'm just a
What do
you're
I
just a
know?
doctor. Uh,
I got to tell you, there's a troll in one of my shorts this past week that was
mhm.
trying to tell me that since I'm pursuing nephrology, that therefore I shouldn't weigh in at all on gender affirming care. And I was like, okay, this is like the most basic level of endocrinology that everybody goes through.
A
Like, and
GP can handle gender affirming
yeah,
care. Like
yeah,
any family doctor can handle this. It's not hard. It's just like, oh, get a blood test. Is the dosage that you're on getting your levels to the within the range that we're trying to hit on the blood test? Okay, it's literally one of the simplest parts of medicine as far as I can tell.
yeah, it's so easy. And then this person also decided to say that doctors shouldn't be activists. And like, okay,
Mm.
so you're just I hope that person can call in. Like if you're out there, if you're that commenter and you're out there that thinks that you have to go through endocrinology to get gender affirming care, give us a call. If you think that doctors should not be activists, also give us a call. If you have any of those opinions, we'd love to discuss that.
I would be so curious. Like, yeah, like, I don't understand the idea that like doctors shouldn't be activists. Like doctors, maybe in a world where healthcare isn't being actively politicized at all times, but like healthcare and how we address it. I'm vamping a little bit. I have thoughts, but I'm also vamping a little bit so we can get more calls in. 720-619-2288. Call us if you disagree with us. But like the idea of how to provide healthcare to a country it's like number one on the list of things that a government should be doing and things that a government should care about. Because if your populace isn't healthy, then you have like it's bad for the economy. People are losing jobs, people are using benefits more. So like the idea that a highly politicized field like medicine that you as a practitioner and an expert in the field who is allowed to be an activist around healthcare if not the people
Right.
who are the fucking experts in healthcare. That's crazy to me.
Like that's literally the job, and especially if we're talking about
You're advocating for
pediatrics,
everyone's care, not just your
your job,
patients. Yeah.
yeah, your job is advocacy. That is
Yeah.
the entire thing.
Jesus.
So and yeah, so it's just wild that people want to stifle the activism. But
Yeah.
nice try, commenter.
Yeah. Nice try.
Nice try. Oh, I also should mention that person was also threatened, like saying that he was going to report me to the Endocrine Society or whatever. Like, cool, yeah, let
Do
them
it.
know that I'm following their guidance, like, and I cite them and
Yeah.
their recommendations, so I don't think they would do anything to me.
Yeah, it's like, did you see recently we had somebody who was like, I'm gonna tell the Creator Association Network or whatever, which is a voluntary organization that we are not a part of. They were like, we're gonna report you. And Jimmy responded to the email like, fucking do it. Send me a screenshot. For why was it? What was it? Somebody
Forrest
called
and John called him
Yeah.
transphobic or something like that. I think
It was
they
called
beat
him a
up on him.
Timu something, like a Timu Philbro, might have been what it was.
Yeah, it was a Timu
Yeah.
Phil, bro.
You called me cheap. I'm gonna report you. Like, okay, have fun with that. Good luck.
With that, I guess while we're waiting for some spicy calls. Might as well go over the schedule for the
Yeah.
upcoming week, which we have a special event coming up this weekend that we're super excited about. I can pull up that schedule too if we want to. But
Yeah.
we do have a big RFR fundraiser this weekend. Actually, Lux, I might let you talk more about that one.
RFR?
If you have a
Yeah. So we
Yeah.
have already gotten to, as of last night when I was looking at it, we have gotten up to $50,000 on our fundraiser for the Recovering from Religion Foundation. And they are just like helping people in their deconstruction from religion and dealing with their trauma. So they have like a chat bot, not a chat bot, but like a chat line that you can go to get advice, and it's kind of like a suicide hotline in that way, where it's like just for helping you get immediate support for what you're dealing with. But they also have like a list of secular therapists that they can point you toward. And we are pushing to get to $100,000 donated to RFR to help them in their mission. And we are halfway to that goal already as of last night. And we're going to keep pushing the momentum and try to get this thing going. So Saturday, we actually have a big extravaganza show, basically all day long, where we're going to have hour-long slots where different hosts are going to come in from the line. I think pretty much all of our hosts are going to be on at some point throughout the day. And there is a big schedule, but I don't really think that you need. Like, here's what you can know: Forrest is going to be on between like 4 and 6 p.m. That's what you really want to know. We know that already.
Yeah.
But yeah, I'll be on for an hour with Justin Deconstruction Zone and Sarah Leaving Faith, and it's going to be like games, and we're just going to be pushing for donations. So support us if you want to help support RFR's mission and help folks with their deconstruction and all that jazz. That's Saturday.
Yes, it'll be a super, super cool event. Hope to see everybody there. And then on Sunday, we've got our usual shows. We've got the Sunday show with Matt and Promise. And then the Sunday show After Dark with Forrest and Austin Archer. Then Skeptalk on Monday with Aaron Raw and Godless Engineer. And then on Tuesday, Chewed Gum with Thinker and somebody else.
We're not
And
sure
then,
yet.
yeah, I'm not sure. Go to that show to find out who got the spot. And then on Wednesday, we've got The Hang Up with Matt Delahunty and Justin Deconstruction Zone. And then back to TACIS next Thursday with Riverbud Jack and Josie. It'll be a great week. So make sure to like, subscribe, turn on that notification bell so you know when we're live, and especially for this weekend for the fundraiser, in case you forget. If that bell is clicked, then and you have it set to all notifications, then you will get a notification that we are live and doing that.
Yeah.
All
Oh my
right.
gosh.
Well, we got a possibly spicy caller in. If you'd like to jump
Possibly.
in
Yeah, let's do
one of
it.
these. All right. Let's talk with Jordan. Him from Pennsylvania. Jordan, you are live on the line with Dr. Ben and Lux. Sounds like you have issues with body-altering medications. What'd you like to talk about?
Yeah, I don't think this is going to be spicy. I'm not going to try to make this spicy. Yeah, I mean, just in general, I don't know, the main thing that rubs me the wrong way, specifically with a lot of gender affirming care, is that it seems to me, right, that when it comes to issues, I mean, I have siblings that consider themselves trans. It seems to me to be definitely a lot more mental of a case than anything. It's being very uncomfortable with your body. I mean, there's lots of other diseases that are similar to that.
So actually, there aren't.
There are.
Are you drawing a comparison between gender dysphoria and body dysmorphia by chance?
Yes.
So they are not the same condition, and in fact, they are opposite conditions. So they seem very similar on the surface. Where I'll start with body dysmorphia. So that is a condition where your brain incorrectly perceives your body. And so you may have seen people who think that they are overweight, or
Right.
they think that they're not muscular enough, or they don't like their nose being a certain way. And then they get surgeries, and those surgeries don't actually help the problem because the issue was their perception of the way their body was inaccurate. So in that case, surgery is unhelpful. And in fact, getting those surgeries can be a trigger for having more disordered thinking about that.
Right.
So in that case, it would be correct to kind of limit the procedure somebody is going to have. However, gender dysphoria is the opposite because there's an accurate perception of what your body is. Trans people, for the most part, are not unaware of what anatomy they have or how their body works, but it still causes them distress. So their brain does not align with the way that their body is, and they are very, very, very aware
Right.
of that. But what we notice with the evidence, the opposite of body dysmorphia, when you give gender affirming care, including hormones, surgery, etc., to somebody with gender dysphoria, their symptoms go away or at least drastically reduce. So if it was
Well, I
similar to
guess
body dysmorphia, we would
to
see that
me,
the procedures wouldn't have that positive
Right.
effect.
and I don't know. For me, I think I have no issues with people going on. I don't know about puberty blockers because puberty blockers do rub me the wrong way. Just because whenever you're involving young kids, I don't know. That's difficult, especially when you're involving any major
Can I
medications
So
ask-
you're going to be
do
taking. I mean,
medications
I would
so do
argue.
medications involving children rub you the wrong way, or is it just that specific one?
Well, it's for me. I think a lot of where I come from, where the things that kind of bother me with this is really just about the safety of the persons involved, right? Now, obviously,
So
in a situation where
we
you're in a
modify.
life or death situation, you've looked at all the different things that you can possibly do, and you're like, we need to put them on puberty blockers, or like.
Yeah,
You
would
know,
it shock you
they
to
may
hear that
cease
that's
to
a
exist
very
as a
thorough
person.
process? That's a very thorough vetting process where we usually have
Right.
to have the child under medical observation for like a couple years before they'll administer puberty blockers. And puberty blockers were
Right.
actually made to deal with precocious puberty. So it's the same thing,
Right.
though. Like, precocious puberty is largely a social problem. So if a girl starts her period at 8 years old, we give her puberty blockers until it's appropriate for, when her peers are all having their
Right.
period. So it's about developmentally appropriate social things. Extremely precocious puberty is associated with all-cause mortality, like if you enter puberty like below age 5 or
Right.
whatever. So these medications, like, there seems to not be a safety concern with using the medications for precocious puberty, but with trans kids for whom it is the same medical thing going on. It's like, we want to pause until it's more appropriate to do the next step or whatever, until we can gather more information. So why is there a safety concern for trans kids on puberty blockers, but not for anyone with precocious puberty, which is the vast majority of kids who access that medication?
Yeah, I mean, I would just have to see what. I mean, if I'm not even sure that is because I didn't know that. I mean, is it so? Or what you're saying is that if you have like an early puberty, there are actually there are issues that arise if you don't block that.
There can be.
So in other words, if someone has, gets their period when they're 8 years old, if a young girl gets a period when they're 8 years old, are you saying that we use that medication because allowing puberty to happen that early is actually dangerous for that individual?
I would not say dangerous. Like,
well, there are certain health concerns that come from that, and Menzies isn't necessarily one of those. Menzies is kind of an indicator of that puberty is happening. But we can see issues with development. We can see issues with fertility down the road. We can see issues with like height, which height doesn't seem like a huge deal, but that is something that ends up being permanent. And I do want to say that a lot of people have this gut reaction to puberty blockers because it just seems like something so extreme, but it's actually one of the safest medications we give to children. There are plenty of other medications that actually have a lot higher risk, even things like Tylenol, not going down the rabbit hole that Maha does with the autism thing, but Tylenol does have risks with liver disease, and we're learning more issues of it with kidney disease. Things like ibuprofen are extremely problematic for children of certain ages. And when we prescribe really any kind of medication, you're gonna have pretty significant risks, and so we balance out, what is the likelihood of those happening, and what is the benefit versus harm ratio.
Right.
And puberty blockers are so minor because really you're not causing anything permanent to happen. You're just slowing down a process that already would be happening. And so I think what a lot of people think that puberty blockers is doing are actually things that hormone replacement therapy does, and not that puberty blockers do. Are you familiar with how puberty blockers work and kind of the mechanism?
I mean, I'm a lot more familiar with, obviously not on a doctorate level because I'm not a doctor, but I'm a lot more familiar with hormone therapy than I am with puberty blockers. Puberty blockers, I would say I really do not have that much information about. Just kind of why I didn't really necessarily speak on them specifically.
Yeah, so it sounds like your concern is a lot related to your intuition, your thoughts of what these medications do. Because if you don't have much understanding about it, it seems like there isn't a lot of grounding for your hesitancy to utilize them. But puberty blockers, it's like Lex was saying, it's really just a puberty pauser because it actually gives you a surge of sex hormones, which then gives negative feedback to your hypothalamus and anterior pituitary. So it's that whole axis that kind of gets paused, but it's very, very easy to turn that back on because it's literally just your body telling your brain, hey, we've made too much of this, we'll slow down. And then once you remove that inhibition, it goes back to what it was doing. So that's different than if we were to give other hormone therapies, like even something related to insulin. Insulin has a lot more permanent effects than a puberty blocker would. So I think maybe if we shift from I feel uncomfortable with this thing and let's learn about it and evaluate the evidence, and we can see, this actually isn't as scary as we think it is when we just hear the word puberty blocker.
Right. I guess my main concern is, I wouldn't go down to that much detail. My main concern with the entire, which is kind of why I wanted to call in here, because I was actually curious how you would respond to it. My main concern probably would be summed down to minimalist intervention, right? So my question would be, if someone has gender dysphoria or those feelings, are we exploring all of the avenues that don't require medical intervention?
Yes.
Before we're suggesting,
which means way fewer people are getting the treatment than need it.
Like in general, doctors, like if you go into the doctor with a headache, they're probably not going to prescribe you some really strong medication. They'd say, listen, take ibuprofen in reason. Don't take
Jordan,
a bunch of ibuprofen.
Yeah, so the thing,
about
I don't know if you heard me earlier, but
practice,
it takes several years of medical evaluation before they will even pause. Like puberty blockers do not change the body. That's like the whole point, is they prevent change from occurring. So it just pauses puberty until you stop taking the medication. So it doesn't change anything about the body. And even to get to that, like, hey, we need 2 more years of time to evaluate this child before we proceed with any other treatments. It already takes a couple of years to get to the place where they're like, yes, we will give you pausing medication to give you more time to figure this out. So this is already an extremely conservative area of medicine.
And Jordan, your analogy doesn't really stand because headaches, sure, if you've had an experience going into the doctor and they've recommended ibuprofen first, which I mean, it wouldn't be ibuprofen, probably be Tylenol first, but that's one case that maybe you've experienced. There are other cases where someone has come in and said, I have a headache, and I'm like, we are taking you to the ER right now for a
Yeah.
head CT. And there's very specific phrases that if I hear somebody say, I'm like,
Right.
this is a red flag. And so there are ways to diagnostically differentiate between who needs earlier intervention and who doesn't. And so I think you're not taking into account that, sure, the majority of people can handle a longer term of waiting. Not everybody can. And so that's where having a medical license, having a medical degree, being board certified, all factor into producing clinicians who can make that distinction and act appropriately. So the things that you're talking about, especially the ones with minors,
I have a question.
Yeah.
Yeah, I guess I have a question for you guys then, because do you guys see an issue where, for instance, maybe you have an individual who considers themselves trans, who's having issues? Is there an issue with them coming in and immediately demanding, medications without any type of evaluation? Because it does feel like on the internet, and I know the internet isn't real life,
Jordan,
but it does feel like on the internet, a lot of people are like immediately like go straight to the medications.
Jordan, are you listening to me?
Yep.
Take a breath. Okay, so there's a difference between how we interact with minors versus how we interact with adults that can make their own decision. So what you are describing, the people on the internet that you're talking about are likely over the age of 18 and have the ability to medically consent to an informed consent model. And so it's the same thing that you do with tattoos, the same thing you do with plastic surgery. If you are above 18, sure, it's good if you get some other evaluation to make sure that you're doing the right things for you, but you don't have to. You have full rights to go get a boob job and not have any other evaluation. That is your right as an adult.
Even that, though, still requires you to have all of the risks explained to you. Like, I went the informed consent route. I was 21. I drove 3 hours to the nearest clinic that I knew of. And I basically was told, like, okay, we need to go through. You need to understand all the risks. You have to sign this paper that says you understand all the risks. We're going to talk about all of the possible things that can happen. So, like, even as an adult, you don't just get to go in guns blazing. They explain all of it to you. Although at the time, my nurse practitioner was like, I have to go over all this, but usually my patients are fully aware of all of this before they come in, because most people also do an amount of research before they run into it. But I don't necessarily fault folks who, like, very soon after they realize they're trans, they go the medical route, because that is the most effective means of treating the gender dysphoria. So if you're experiencing dysphoria and you know that there is a treatment that is like 99.5% likely to work and to help resolve that problem, then it makes sense to just be like, okay, I'm going to do the almost 100% guaranteed treatment that's going to fix the problem. And I encourage people to be in therapy in general, because I know that there are some, it's like, oh, there are occasionally people who go into it a little bit too fast, but taking on risk is part of your rights as an adult in America. Like, you have the right to take risks about your own body. And to an extent, children also have the right to take risks about their own bodies with parental consent and doctor's awareness. Like, kids play football and they get concussions and they get permanent knee injuries, and they start ballet when they are 5 years old and permanently change the structure of their ankles. Even after only doing it for a couple years, your doctor, when you're 40 years old, is still going to be able to be like, oh, you were a dancer, huh? It fundamentally can cause dysfunction. And we allow children to do that. So, like, taking on risk with informed consent is just how life works, and it's how medicine works.
Right. So I guess from that, you do believe in parental consent, at least when it comes to these types of things.
Yes, and
there are no
pediatricians that are prescribing puberty blockers without parental consent or without discussion of the parent, the child, and the entire healthcare team. Like, this is a multidisciplinary discussion.
Yeah.
Right. I mean, wasn't there something passed in California, though, that was trying to change that?
There might
model.
have been like something in the schools in California where it's like a teacher is not obligated to out a child to their parents, because some like children have the wherewithal if they're coming out to a teacher and not to their parents. It's because they know that it's not safe to come out. But in different states, there is different ages of medical consent. Like I think in Kansas, where I'm from, the age of medical consent is 16, but you wouldn't be at 16 years old getting puberty blockers. You would just be getting cross-sex hormones. Um, and even then, I'm sure that it's going to vary by practice. Like some practices might not do it, even if it is not strictly illegal, just because they want to avoid liability for civil lawsuits. But yeah, I mean, like, I support advanced age teenagers having the right to get, like, I've seen teenagers get themselves vaccinated when their parents are anti-vax. Like, do I think that you should force a person to wait until they're 18 to seek what they view as essential medical care? Like, no, that seems ridiculous. But if we're talking about a 10-year-old, then yeah, I'm going to be like, look, we're going to get the parents involved. The first treatment that they're going to get is cutting their hair and changing the clothes that they wear. We're going to try out this social thing and have them in therapy and get their like endocrine systems tested or whatever needs to be done. Like, yeah, I for young kids, of course, I want the parental involvement. I want the kids to have support in their lives. I don't want kids to be like causing friction with their parents and having legal disputes over whether they have the right to do what they want with their own bodies and stuff. Like, yeah, that would be a nightmare.
Hmm. Yeah, I'll be honest. I did not expect you to say that.
And a lot of the medical consent things for teenagers is to make sure that teens have an avenue to get care that they need, if they're uncomfortable telling their parents. But that's not really with trans things. That's related to STI testing, pregnancy testing, things like that. So a teenager in a lot of states can go and get STI testing or a pregnancy test without their parents being alerted, which is a huge like improvement in the system, because otherwise those teens would just not be getting care for that. So
I'm pretty sure that children can't go to the doctor's office by themselves. Like, you have to have someone like legally able to consent to care.
That might depend on the state. I feel like I was going to the doctor by myself by the time I turned 16 for sure.
Yeah, age of medical consent is 16 in a lot of places.
Before
so that would make
have to
sense.
have a parent.
Yeah.
Yeah, you have to have a parent before that.
Okay, that makes sense.
Yeah. And the only things other than that, like where you can technically like override consent, is with implied consent for young minors. And that's essentially if it's emergency care and they are like unconscious and you can't get a hold of the family.
Right.
And like if it's something that is immediately life-saving, then you can do without. But if there's any chance that you can wait, you have to call the family. You have to get verbal consent.
Yeah.
If it's not immediately life-saving.
And even then, there are times when like the medical needs of the children override the parental consent. Like a Jehovah's Witness, like a hospital will just give your child a blood transfusion if they need it. And you as a parent, I don't think that every situation a parent should have the right to override medical consensus. Like, so you ask in the question, like, do I think parents should be involved with the gender affirming care process for youth? Yes. However, also, do I think that it should be considered a case of medical neglect if a parent refuses to get their child gender affirming treatment when that child is extremely like debilitated by it? Like, yeah, I do actually think that there should be like some mechanism to prevent medical neglect, and that is a form of abuse. So it's like parents don't always know what's best. Not every parent has a medical degree, and we shouldn't expect them to, and we shouldn't allow just their feeling that they own their child to supersede the well-being of the child. I think that's crazy.
Right. So I have a question, like a specific question for the doctor. Sorry, I didn't catch what your name is.
No Dr. problem. Ben, he's the expert.
Dr. Ben. So this is just a personal anecdote, and I'm just curious what you're gonna say. So when I was probably around 23, 24, I started losing my hair. And I remember one time I went to the doctor's and I, just as a joke, passingly said, I think he said, "Are you doing all right?" or something like that. And I'm like, well, besides, starting to have male pattern baldness, I'm pretty fine. And he immediately was like, well, we can get you medication for that. and I knew immediately what he was talking about. He didn't actually say it, but I knew he was talking about finasteride, which I had already considered. And just due to the fact that I know it was originally made to deal with prostate issues, and it changes things with your testosterone, I did not want to get on finasteride. So if you could compare maybe the possible downsides of taking finasteride for the rest of your life to the possible downsides of puberty blockers, how would you rank those two medications?
There aren't really a lot of downsides with taking finasteride long term. It seems like you have a kind of a misunderstanding of the endocrine mechanism of these. So it's not a global testosterone blocker. It's specifically a DHT receptor blocker. And so there's, with your development and with certain male characteristics, you have different receptors that trigger those. And so the way the prostate develops is through DHT receptors. And that's why a lot of people in older age will get prostatic issues and they have to go on something like finasteride. But it also, the way hair growth happens is because of DHT. So that's how you get a lot of facial hair growth. That's how you get male pattern baldness, interestingly enough. So it specifically targets that one part of the pathway and not the entire thing, which is why doctors are so comfortable saying, yeah, here, let's give you some finasteride, because it's so low risk and only targets a very small part of the pathway. And that's very similar in a way to a puberty blocker, in that it's targeting a very small part of the pathway and really doesn't have a lot of risks for the whole rest of the system. So I think there's a lot of intuition from you going into this. I think you know enough about the endocrine system to be misinformed about it. So I think it's fair to ask these questions, but don't get too bogged down in, I think it does this thing, therefore I'm worried about it. Like, investigate a little bit further, because some of those details are a bit nuanced.
You also only take puberty blockers for like 2 years before it does start to represent potential damage to like the structure of your bones. So it's not like comparable in that way, where it's like you take it for a really, really long time. But like, yeah, they're basically like, if you correct for that and only do it for the 2 years, there aren't like long-term adverse effects of puberty blockers. Like, yes, if you stay on it for 5 years, then there could be problems, but it doesn't typically develop within the time frame that we're talking about using it for treatment of trans youth.
Right. Well, I mean, I will say one other thing that seems to bother me as well when we talk about these conversations is the issue of fertility, because it seems like people really like to downplay, the possible fertility issues that could come from this, which I think are important, but a lot of people are like, yeah, who gives a shit about
It's
fertility,
negligible.
whatever.
It's
that does
it's
kind of bother
negligible.
me.
It's
It's negligible, and also sorry, we just jinxed.
like, I think we're going to the same point.
It's fucking weird that y'all are thinking about the fertility of children. It's so creepy. And I'm not trying to say, Jordan, that you're a creep or anything, but like the fact that this rhetoric is normalized is so fucking creepy and disturbing, that we're trying to preserve the fertility of children. I hate it. I hate it. I hate it. And also, yeah, it's like there is basically no impact to their fertility on puberty blockers. Cross-sex hormones can impact fertility, but even then, the human reproductive system is quite tenacious, and you can get pregnant or impregnate someone while you are on cross-sex hormones. It is not an effective form of birth control. Like, yeah, there's so many issues with that.
Yeah, I mean, I was mostly talking about cross-sex hormones, not necessarily puberty blockers. And I just think, I think one of the most important decisions someone makes in their entire life is whether they want to have a family or have kids.
Jordan, why would our response
always kind of
that's their decision, though, right, Jordan?
And if you're really worried about this, why would you not just advocate for like gamete preservation as a matter of course in this care? Like, okay, you want to start cross-sex hormones, we're gonna get a sample of your genetic material and keep it for when you're ready to have kids later. Like, if the impact is so grave, then why would we not just be like, well, we need to start saving people's sperms and eggs before they begin the treatment. But like, yeah, it doesn't seem that it's like broadly necessary.
Yeah, and it seems like the similar argument that people give that people shouldn't get like sterilized because what will their husbands think or what if they want it later. It sounds like the same rhetoric that people use to control people's bodies. So not a huge fan of that.
I mean, for me, I see it as more of a societal issue than an individual issue, I guess.
No, it is
2%,
100% an individual issue.
If
So
2%
think
of people are infertile, do you think that that's like society's going to collapse? Because 2% is like the upper estimate of the number of transgender people, and that's assuming that every single one of them gets access to treatment before they've had children, which lots of people have kids and then do treatment, or they pause treatment to have kids and then they proceed. Like 2% of the population not reproducing. Like what negative impact is that going to have?
And that's just kind of gross to me that you think that it's a societal issue what somebody else does with their reproductive system. Like, do you think it's people's duty to reproduce?
I don't know. I see it a lot of times. I feel like people are pretty anti-natalist about it, if I'm going to be honest. Like, it's usually not just,
Dude, I don't care.
What do you do with your body?
Jordan,
most people are usually just like,
I do not care what you think. I do not care what you think about whether or not I should have children. I don't have to listen to you when I make that decision. And the fact that you think you get to make that decision for somebody else or that your opinion matters on that is really kind of gross.
I mean, not necessarily my decision specifically for you, but as a society, I think any society that isn't very careful when they're talking about fertility or having
because we're
children,
talking about policy making, Jordan. We're talking about what's legally permissible or what's accessible medically. So the idea that a doctor or a politician can dictate to you that you must have children because it's for the good of society, that's bad. That's a bad kind of society to live in. Like that's like a type of authoritarianism where the government doesn't care about individual autonomy and is like putting its own preservation above the good of the people and its populace. Like that's creepy and weird and bad. You should not want to live in a society.
I feel like that's going a bit too far though, because it's not like, you could also argue that, I mean, I don't know how you are in the drug issue, but you could also argue, the legal system telling you you're not allowed to do heroin is authoritarian, you know?
Yeah,
and it's like,
that's because it is.
If you want to limit drug use from doing drugs,
listen, Jordan, if you want to limit drug use in cars, if you want to limit drug use in public, those are matters of public safety. But limiting what drugs people can do in their own house is fucked up and authoritarian. It's just like making alcohol illegal, prohibition. Like people figure out a way to do it and it increases the crime and doesn't help people.
And increases risk to people's lives.
Yes.
If you don't give them safe places to use and safe equipment and ways to get help, it does hurt outcomes to outright ban those things. Like decriminalization is important for these. Because if somebody is too worried about getting prosecuted and going to jail because they went to the hospital for complications of heroin use, like I would rather them go get help and be able to.
And not get arrested for it.
Some punishment for it.
Yeah, I don't know. For me, I do agree. I've met people in college that had issues with drugs, and it always bothered me that they were always so scared of going to the police. I remember there was a specific time where I literally, in my freshman year of college, there was a guy who was like a friend of a friend of a friend who was ODing, and they literally would not let me, they did not want me to call an ambulance or drive him to the hospital myself. I didn't do any drugs because all the rest of them were doing drugs and they thought they were going to get drug tested. And so I see where you're coming from there. My issue is, does legalizing it make it something that might end up just becoming normalized? Will it normalize it and make it more likely that society is just going to be like, yeah, sure, just do drugs, whatever. Like nobody cares, just do drugs.
No, not necessarily.
I think there should be societal, and I feel like when you look at cigarettes,
Jordan, there's a problem here.
Like
when you're equating legality with normalization. Have you seen the downtrend of people using tobacco products? Like tobacco is still completely legal.
Actually,
Cigarette
there's a
use is
huge
still completely
downtrend.
legal.
You can look at it. Teens are not doing tobacco. Well, I guess
Right? It's still
until
legal,
vaping
though.
came around. There was an exception until vaping came around.
But so the point
But
is,
in
we've
general,
improved public
the
health
cigarettes were
initiatives.
going
We've
massively
improved
downhill
education.
until vaping came around, and
Oh,
that kind of.
but Jordan, the whole point of this, and I think we're kind of nearing the end of useful discussion here, but the point is,
Yeah.
you've made a lot of statements on this show from your intuition and you thinking that certain things are bad, but not really having a lot to back that up. And we give you all of these points of evidence and all of these arguments that support why you're wrong. And then you just kind of go on to something else. I think we're nearing the end of this. Lux, do you have anything
Um,
else here?
I was just gonna say that I don't think that we should do one solution to a given problem, right? Like, so it's authoritarian for the government to tell you whether you can smoke weed in your own house, right? And I'm not speaking to DWI. Like, I agree that we should limit people's consumption when they're in situations that can cause public safety issues, right? But also, I don't think we should just decriminalize drugs. I think that we should also simultaneously create safe use sites and generally invest in the well-being of our society, because there's a really famous study that was done on mice or rats where they would provide cocaine to them in different environments, and the rats that basically like were isolated and alone used the cocaine a lot, but then when they are like the ones that were social and like reintegrated into a big social group of rats, they didn't use the cocaine so much. So it's basically like there's a huge body of evidence that drug use is a side effect of like having a shitty life, and like people use it to cope with mental health problems because they're broke and they can't afford things, and they can't do anything fun. So like I think decriminalization of drugs has to go hand in hand with reducing the situation that causes people to use drugs, right? So we can do both things. So I'm like, with all of these things, I want to prioritize bodily autonomy and harm reduction, and I want to improve quality of life. And it is just almost 100% the case that administering puberty blockers to trans youth is improving their quality of life. So like, there isn't a significant medical reason to not give them that.
Not to mention that improving the quality of life in trans people also reduces drug use disorders.
So true. Yeah. And suicidality and all the other negative like mental health behaviors that are associated with low quality of life. So yeah, administering cross-sex hormones at the appropriate time and puberty blockers at the appropriate time improves medical and economic outcomes.
Yeah, I mean, I just want to say before I go, I wasn't like on a massive hard stance on any of these issues. The reason I keep bringing up other things is because I figured it would be better for your show. In general, I think a lot of the stuff that I've heard you guys say today was actually really reassuring to me, because it makes a lot more sense than a lot of the rhetoric you hear online, which doesn't usually involve a medical process and therapy. A lot of the stuff that you hear online is, let's just get them straight to puberty blockers. Let's just get them straight to cross-sex hormones. No discussion with the therapist. I would say I wouldn't even want to put someone on SSRIs. I'm not a doctor, so I don't have a say, but I wouldn't even want to put someone on SSRIs without at least speaking to a therapist once. Right?
SSRIs
And
are
so that was a
way
big
worse than puberty
concern that I
blockers.
had.
Yeah.
Really.
Yeah.
Yeah, I hear you though,
All right.
Jordan, and I'm glad that we've kind of assuaged some of the anxieties that you're having, and I hope that you're able to carry that forward into like more conversations, and like you're able to maybe identify the misinformation. Because if you're seeing people talk about like, let's fast track this child onto, let's get them right into the surgical theater, like that's you I hope will be able to recognize that and go, wait, where are they getting that from? Like, where is that assumption coming from? Where is that happening? Like, investigate and ask yourself like what bias that person is coming at this with and what goal they're trying to achieve politically by pushing what is functionally misinformation. And if there is a doctor out there who's sidestepping the rigorous process, then we would want to know, because we want everybody to be held accountable. And I'm not going to sit here and say like, yeah, it's okay that doctor gave testosterone to a 12-year-old. Like, okay, yeah, I'm going to be like, okay, there's concerns with that. I want to know what happened there. Yeah. So I hope that you're able to carry that forward, Jordan.
Yeah. I mean, I guess I probably have one last thing I want to end on, and is what is your guys' opinion on a lot of these detransitioners coming out, and a lot of them saying that they felt like they didn't have enough resistance, or it didn't have enough people saying, hey, listen, let's think about this a bit more. Because a lot of them are kind of, they don't speak about it like they're necessarily going through like a real rigorous process. They speak about it like they just had some yes man saying, yes, do it, and then they regret it.
I mean, what age
now,
are we talking
can't
about?
confirm
Like,
their stories, but I was just
are
curious
these
if you
adults
guys
who
have...
want to be coddled through a medical process? Like, I don't know why people would want more pushback of them being like, yes, I am making a medical decision for my own body. Like, why should there be pushback? Dr. Ben, is there any other situation in which a doctor will be like, hold on, you're telling me you have these symptoms, but wait, if it's not just like, let's do some additional testing to rule out some other thing, which there really isn't a thing in trans medicine that's like, oh, it's actually this other thing.
Yeah, no, it's really not realistic. So, and it goes more hand in hand with, like, we're talking about SSRIs and things. Like, there's things that tend to have more of a subjective component. It's like the process is just going to look different as far as diagnostic criteria than for something a bit easier to see on labs or X-ray or something. So it's not saying that there isn't a diagnostic process. It just looks different, and the way we handle it at different ages is different. And a lot of what we're seeing with the detransitioners, there's very, very few of them who are very vocal that get flown around the country to say the same story over and over again. So it seems like there are more of them.
Yeah.
And in a lot of the stories, there are some red flags that come up that are like, I don't know if it happened in this way that you were saying that it happened. Like, and I'm not saying that people don't detransition. There are people that do, but the way that they make it sound like they got through without any guidance, without any diagnostic process, I question the accuracy of that full story.
Yeah. And I just want to add as a final note, and then we'll wrap this conversation up. I don't know if you know Chloe Cole. She's like the most famous detransitioner in America. She makes $200,000 a year from speaking engagements. So it turns out it's actually incredibly lucrative to publicly detransition and speak out against trans rights. So again, asking yourself, why are these people saying these things? Is what they're saying accurate? What reasons could they have to say this? Chloe Cole has $200,000 a year worth of reasons to say that she got fast tracked onto that medical care. Like, so yeah, there's like questions about the legitimacy of those claims.
Right. Yeah, and I will say, I have a sister who was considering treatment, and she did talk to a therapist, and they actually reached a mutual agreement that she didn't want to do treatment. So I will say personal experience does kind of support, not that personal experience is necessarily evidence, but, there was a whole process she had to go through herself. So, I mean, that makes more sense, obviously. Yeah, I don't know. I don't know if I have anything else to say. Thank you for the discussion.
Appreciate you, Jordan.
Thanks for your call, Jordan. Talk to you next time.
Thanks. Bye.
Bye. All right. Do you have any preference on any of these? We got a lot of people showing up now.
Yeah. Thank you, everybody, for calling in today. We appreciate all of the stimulating conversation. We're going to be taking calls still for about another hour. At which point we're probably going to start to segue into our super chats portion. We are having some tech issues, so the super chats portion might be a little bit weird today. But yeah, at least another hour of doing these conversations and taking calls. I would say lines are pretty much full now. So if you haven't already gotten in, you might want to wait until we start our next show in an hour and a half, where I will be on with either Jimmy or Jovan. I don't know. But if you want to call and talk to me, you might have to wait a little bit because our lines are basically full right now. Let's see. Ba. A lot of these seem like more conversational. Does that read to you? Okay.
Yep.
Is there one standing out to you in that context?
They're all kind of similar. We could
I
go
feel
in
like
order unless there's
18.2 is an
we can do
interesting
that one.
conversation. Yeah.
Do that. Yeah.
I'm gonna go to the bathroom though, so I'll let you start that.
All right. We're gonna talk with Ray, he, him from Arizona. Ray, you are live on the line with Dr. Ben, and Lux will be back in just a moment. But what would you like to talk about?
Yeah, so I don't know the best way to put this, but not to be inflammatory, but if being trans could be like quote unquote cured, would that be something you wanted?
Like,
so
in
like
what sense do you mean cured? Do you mean if like I would be happy in my body before transition, or if I were born as a cis person
right, that would
of
be
the
the
gender I
more
identify as?
questionable sort of thing, which has the same sort of problems as like trying to cure like autism or whatever.
So my answer, if I could be cured and just not identify as a man and be okay with being female, then no, I would not want that, because that person would not be me. And if it was the opposite, if I could be cured by being assigned male at birth, that is a bit more difficult of a question, because I think I would probably feel healthier as a cis man. I would have not had to deal with a lot of the societal issues. I wouldn't have to spend a lot of money on extra healthcare, all those things. So that's something I'd have to think more about. But as far as just not being a trans person and being who I was assigned, no, I would not want that.
Right. That's what I was thinking you would probably say. But then let's say there was some way of telling that a fetus would have gender dysphoria or whatever, and you could do something simple like, I don't know, give them more hormones or something that would make it so they developed, or their brain developed or whatever, to be their gender more in line with what their sex will be.
I don't think
that
would
be
ethical.
A good idea?
No, I don't think that would be ethical. I think that has the same kind of eugenics undertone. That would be trying to cure autism in the womb, or try to reverse some condition. That I think there's a difference between addressing conditions that are purely within the body, to where the person would still be themselves, but modifying something that is the person. I think that has ethical issues. So I would say no. And Lux wasn't here for the first question.
I mean, I get the vibe. Yeah, like, so if there was like a thing that you could do for someone in the womb to prevent them from developing gender dysphoria, basically, is like the vibe that I'm getting. Yeah, so I agree that that's highly problematic because, because being trans is like a normal aspect of human variation with a distinct cultural aspect to it as well. So it's like, like the majority of deaf kids are born to hearing parents, right? And sometimes there are interventions done on them at a young age that maybe they don't appreciate when they get older, but like their parents are doing their best to help their kids hear. They got them cochlear implants because they were trying to do their best. But as a deaf person who has a unique human experience, a unique cultural experience, some deaf people don't want to be hearing. They don't want to. So there is an element of like, we're trying to like improve things for like the human race, quote unquote. But by doing that, we are like destroying important aspects of who people are. And that's like scary. It's like scary, the idea that we're going to
Yeah.
eliminate differentiation, that we're going to eliminate diversity, that we're going to eliminate differences, in a way that it's like,
Right.
I don't know
Like,
who I would
the
be if
worst
you
part
hadn't
would
done this to
be-
me without my consent, you know?
Yeah, like the worst part would be if the government sort of identified the perfect person and then said everyone has to be born this way. That would be problematic on many levels.
Who's
So
deciding
I
is
guess
such a
the
critical question,
underlying-
Ray. Like, who gets to decide which traits are desirable
Right.
or not?
Right. So the underlying philosophical question would kind of be, do you see being trans as being good despite of the downsides, or because of what some people would call downsides?
I would say that the major downsides to it are culturally inflicted. And so, like, if we didn't have that, then there would be no downside. It would just be a medical condition that you would get treatment for.
Yeah.
Like having glasses is just a thing that you get. You just get a prescription and then you solve the problem, and there's no social stigma or anything. And you're just like, boom.
Right.
And you can get LASIK if you want to, even though there's risks associated with that. Yeah, I think that it's like, it's neutral until society starts treating you badly about it.
Right. I guess that makes sense.
Yeah.
Yeah. Well, I guess that mostly answers my question.
Yeah.
All right.
Like, being trans is important to who I am as a person, and I have no fucking clue who I would be without it. And I would be so pissed if I found out that someone messed with my brain when I was not even born yet, to like change who I was going to become. Like, I know of at least one online creator who is like an IVF with genetic modifications baby, and she's like, I have significant problems with the fact that this was done to me without consent. Like, it's not cool. Yeah, so that's the long and short of it, Ray.
Yep. Well, thanks for your call, Ray.
Yeah.
Appreciate it.
Oh, and if I could say one more thing, for the previous caller, if they're so concerned about birth rates, they should just advocate for families to be in better economic positions, because that's the main reason.
Free childcare. Exactly. Yeah. If you want to promote people making families, you have to make it easier for them to make families, for sure.
Yep.
Well, thanks, Ray. We appreciate you. We'll talk to you again sometime.
Yep. Thanks.
Bye. All right.
It's a show and we're doing it. And if you haven't hit the like button, then you should. I pulled up the tab for Elagabalus earlier. I was fully ready to be like, let's talk about this Roman emperor who wanted a vagina so bad. Don't need that tab open now. Let's close that tab.
Yeah. All right. Do we want to go down the list, or do we want 16-1 or 12-8?
Two of these are the same call. So let's take the one that's been waiting the longest.
All right. So the 4-3?
Yeah, let's go for it.
All right. We're going to talk with Ash, he, him from Ohio. You are live on the line with Dr. Ben and Lux. What would you like to talk about?
Yeah, I have always been masculine male, and for the last 5 years, I've really been questioning a lot. Being in Ohio, being in Trump's America makes that kind of difficult, but I don't have the standard male dysphoria that normally presents itself, but if I could push a button and make myself a girl, I would do it tomorrow. So I don't know if I'm, yeah.
I mean, yeah, is there some particular angle that you want to try to hit that from? Like any specific issues?
Well, the biggest thing is I'm not sure if how much the gender dysphoria is required, I guess, for me to identify as trans, to decide that I'm female or male. Because I don't, every trans person I've ever talked to has talked about the dysphoria, and it doesn't quite match with me. But
yeah, not everyone
I
has it. Not
okay.
everyone has gender dysphoria. I think a lot of people do have gender dysphoria, and previously it was considered diagnostic criteria, so to speak, for being considered trans. However, we've learned kind of over the recent past that a lot of people have gender euphoria that's more predominant, or maybe they don't have dysphoria at all and only have euphoria. And some people just don't really have either, and still do experience gender incongruence in some way, to where that they know that they aren't the gender they were assigned at birth, but still kind of fit into the trans category. So it's okay. You don't have to compare yourself to other people, and you don't have to have your stories line up exactly. It's something that's common, but a lot of people don't experience dysphoria at all, and you're the only person that can really understand for yourself if the trans label does fit with you, or what gender identity fits with you.
Yeah. It all kind of started when my first wife got pregnant, and the amount of jealousy I had for her. And that's when I started like connecting dots, and was like, oh no, I think I might not be a man. And like, I've always been more feminine in a lot of ways. And so,
I mean, that can help. Like, I mean, in any process of figuring out like where your gender feelings are coming from, or like where to direct them, I mean, it is kind of a process of like trial and error, right? Like, if you're like, oh, I really wish that I could be pregnant, and it's a bummer that I'll never be able to like participate in motherhood in that way. And if you further that thought process and you go like, yeah, but what if I was a stepmom? Like, can I see myself in a stepmom role? Does being in the role of mother, even though I can't have children biologically in that manner, like, would that be fulfilling? So, like, I always try to encourage people, especially very early on in the process, to just experiment with different things, to like try out different stuff and see how it makes you feel. And some of that is going to be like, okay, let's see how we feel about some stereotypical things, right? How do we feel about painting our nails? How do we feel about cutting our hair? How do we feel about these different clothes? And that's just part of the process. And it's definitely not going to end with you being like, ah, yes, this is the exact type of woman that I am. Is like, it's typically not going to stop there with painting your nails and makeup and stuff. Like, a lot of trans girls go through a process in the beginning where they're like, yes, I'm going to lean hard into the feminine and it's going to make me feel really good. And then they kind of bounce back and they're like, oh, yeah, well, I'm like, there are other types of women. Like, there's women who go hiking and there's women who work on cars. Like, what kind of woman do I want to be? Like, it's a refinement process, which is, it's just like being a person. Like, what kind of person do you want to be? And you'll find that changes over time as well. Like, you're going to be like, oh, I think maybe I want to become a person who goes hiking at 5 a.m. and like all the logistical changes that have to happen in your life to make that happen. So yeah, I always encourage people to experiment, see how you feel, try out things. Don't worry about getting married to any one form of expression or presentation or any, name or whatever. Like, you can go through a process with like, I'm going to try out different names for a while. And sometimes you're like me and you change your name legally when you're 18 and then you're 32 and you want to change your name again. So stuff like that happens sometimes. And you just have to be open to the fluid possibilities of the future.
yeah, I know I'm not going to do anything, like I'm not going to talk to a doctor until kind of the MAGA movement's over, because I don't want to put my name on any list that anyone will ever find until all of this settles down. So I know that, but other than that, I've only talked to a few people about it, and I've kind of been working on some names. I've been working on some stuff. I'm dealing with my kids, trying to figure out exactly where I want to be and what I want to do.
I mean, I would encourage you to not wait that long because, like, who knows if they're even going to leave power. But it's, it's like a personal safety assessment that you have to make. Like, I changed all my shit when it was safe to do so, and yet my name is on a list. Like, but nothing, like nothing has happened, and I've moved to a place that's safer and everything. Like in Ohio, yeah, it's tough in Ohio. It's definitely like a lot weirder and more conservative in Ohio than I would have expected, but you're not too far away from a state that is normal and not a terrible place to live. So you could, I think, easily relocate. As far as like, Minnesota is not too far from where you live, and it's probably going to be culturally very similar and have all the protections that you'll need and everything. And like, obviously, HIPAA protects you to some extent with like keeping your information private. So I would encourage you to, you don't have to necessarily go all in all at once, but it probably wouldn't hurt to like try out like a testosterone blocker and kind of test the waters and see how you feel with that. And that's the kind of medication that you could easily stop at any time. So yeah, I'm not going to like push you to do anything unsafe or whatever, but like the likelihood of something bad happening to you personally just because of your medical information is like pretty low.
Yeah, it's more related to documents. When you once you start changing documents, it gets a bit more tenuous depending on what state
my name's
you're
on a
in.
list because I changed my legal sex on my driver's license, by the way. Like that's the reason why my name is on a list. At least one list. But yeah, so but generally I'm just encourage you to not let the current environment paralyze you from doing something that is going to make your life better.
Yeah, I've had multiple issues with depression and anxiety and things like that, and I've been told that can partially be because of me not feeling right in my own skin, and that it might be that my life might get way better if I just go forward with it. Because I mean, it's been 5 or 6 years now that I've been thinking about this, contemplating it, shifting back and forth.
Yeah. If you start the medical process, it is astounding the number of people, especially who start estrogen. Maybe that's just because I talk to a lot of trans girls, but within a couple weeks, you usually are like, I see. My brain is normal now. So before you even start to see the physical impacts of the medication, a lot of the times the emotional stuff gets alleviated almost immediately. I'd actually be there's no really way to do placebo trials about that. But I would be so fascinated to see like how much of that is just the power of the mind versus like just the hormones being in your brain and your brain being like, relief, sweet relief, the correct hormones. But yeah, so I would say you can try it and then be like, oh, actually it doesn't work for me. And you will know before 8 weeks is up. Like 2 months of hormones and just see how it goes. And then that'll help you. That'll be critical information to help you make decisions going forward.
Yep.
Okay, I think I might do that. Thank you for the advice.
Yeah, absolutely. We appreciate you calling, Ash, and I hope that things go well for you.
Yep. I hope so too.
Yeah, good luck.
Take care. Bye.
I did it.
You did a thing.
I got another one.
We're out here making the people trans.
Exactly. I'm transing all of your kids. Yeah. I'm sorry I fucked up the lower third. Okay, finally somebody fixed it. I'm sorry. That was me. I goofed it. So that entire call, we just had the wrong thing up there. That was my fault. Now it's fixed. Shout out to either Jimmy or Arden, whoever's doing the tech stuff right now.
One of them.
Yeah. Okay. But now I can do this. I, as a host, can control what happens down here, which is how I messed it up. So yeah, when we take our next caller, if Arden is busy, I can change it.
Oh, that's cool.
Yeah.
Fancy.
It's so fancy. Do we want to just keep going down the line? I don't really think any of these are particularly jumping out. So
yeah, I was thinking we just do that.
Cool. All right.
All right, let's talk with Dave, he, him from California. Dave, you are live on the line with Dr. Ben and Lux. What would you like to talk about?
Oh, so wonderful. Thank you. Man, that was a long wait. Appreciate y'all getting to me.
Yeah.
Yeah, we appreciate your
appreciate
patience.
you staying on the line. Yeah.
Hey, well, I've actually, I was in it for the long haul because I've been trying to call in for about 3 or 4 weeks. Basically, every time Ben's been on, I've been wanting to talk with him, with you,
wow.
Ben, because you are a doctor and a trans man, and I'm seeking some advice. I'm the parent of a trans child, a trans mask, pronouns he, they, who's about to turn 18 very soon. And it's been a nightmare trying to relate to him. And I'm seeking advice from you to try and find a way to connect with my child before they go off to college and I'm not going to see them most of the year.
Yeah. Is there anything in particular you're wanting to know about?
That's rough because there's so many things going through my brain, but like I guess I'm trying to separate or maybe identify what is maybe a result of dysphoria and environment and what's like typical teenage angst, because like it's always contentious, and I'm very, very supportive of the of his identity. I'm very, very practicing in using the pronouns that he wants. And ironically, his mom still uses she, her pronouns, still treats him like a girl, and yet they're closer. And I'm so confused on that, on how I want to be supportive, I want to make connections, and I'm just so lost.
Yeah, that can be tricky. And some of it might be that the two of them just have some more things in common from a personality standpoint. And those particular things you can't really help. But I think it's great that you were making a good effort. Is there anything that your kid has expressed like they really want to do more of? Maybe even things that are more stereotypically masculine that maybe they wouldn't normally like feel as comfortable like um doing with their mom, or any particular special interests they have?
Mostly anime and gaming.
Yeah, so
very,
I
very,
think
very
like
heavy into the anime and gaming.
yeah. Yeah, so
That's a really
I
good
think
place to
it
find
can,
common ground. You know,
yeah.
share your video games.
Yeah,
Yeah.
He asked me to watch Chainsaw Man with him. We started watching that one. Really interesting. But obviously we're not here to talk anime fandoms. But yeah, so I've been trying to okay. So the real challenge is like I keep trying to be like, hey, let's do stuff together, and he's just like, nah, like no,
Yeah,
not
so
interested. No.
Yeah, part of that might just be teenager, young adult just wanting to be more autonomous, more independent, might just perceive that there's a difference in interests, may perceive that um, that's not something they're interested in doing. So I definitely see where it is difficult to kind of tease out like what is related to being trans and what's related to being a young adult. That particular aspect, it sounds like if you're making a good effort and the kid's just not super interested, it might just be that. It might just be they want to go and do their own thing, or maybe a personality mismatch. And like what I was saying, I think it's okay to
There's
keep
definitely a
offering things.
recent jump for personal independence that he's really chomping at for sure.
Did you say that they're going to be going to college relatively soon?
Yeah, he turns 18 in August and will be graduating next month from high school.
Yeah. Yeah. That's super duper normal. Like, it's so, listen, I adopted my younger sibling who's about to turn 20, and it has been a very trying part of life where I'm like trying to correct issues from like the reason I adopted them from my parents, because my parents were neglectful and all this. So it's like, I'm trying to help you be a person, but also you're just biologically in this age where you're like craving independence, and you don't want to be vulnerable, and you don't want to talk about things, and you're just trying to get out of the situation. And it is really trying to be like, I'm trying to be supportive. There is so much background noise right now, Dave. But when you're trying to be supportive,
sorry, I was getting some jerky out of a bag.
oh, good. Yeah, understandable. It was just a little bit distracting. But I really feel you on that. And I validate how frustrating that is, where you're like, I'm trying to help you with this critical transition period in your life, and you just kind of don't want to have anything to do with me. But it's like literally biologically normal for that to happen at that age. It's like when, the birds leave the nest, like it's quite literally like a biological thing in you that you have this urge to leave the home. So yeah, I would say just trying to be like a steady presence and be like, anytime you come home from college, you'll have time and you'll want to plan for that time, so that maybe right now when y'all are seeing each other more often, it's just kind of like meh, and your kid is able to sort of take your presence for granted in a way that they might appreciate more if they're only seeing you on holidays. But there's also little things like, I don't know, you would have taught your son how to shave at age like 14, and that's a thing that you could do now. You'd be like,
right,
hey, listen,
I have a 13-year-old that's starting to. My youngest is getting that little wispy mustache now, and that's coming up where I'm going to have to start teaching him to do the razor.
So that's a thing. You could be like, listen, I'm trying to give this to you as you're entering your adulthood, and you might want to go on testosterone. Like, let me teach you how to do this like manly thing, how to manage your facial hair. It is different than shaving your legs, which is something that they may have already been doing prior. Like shaving your face, it's much more delicate skin. So like, yeah, that is just one thing. Try to think of like, what are some man skills that you can impart right now? Like, has your kid ever changed a tire before? Has your kid ever checked the oil in the car before? No. Everybody should know how to do those things, but it's especially like as a father, a thing that you can teach your son to kind of bond on that like practical skills element.
And especially something that they need to learn before going to college, because at some point, if he ever has a vehicle, like knowing how to check your oil is important.
Even if your friend is driving you around and the tire blows out and you need to know how to push a vehicle into a parking lot, like that is a skill that the peers might not have, and that I'm sure that he will appreciate, as like how can I acquire more masculine skills? And like, maybe your kid is more of one of those like nerdy, I watch anime and play video games and I don't get my hands dirty kind of kids, but it's just good stuff to learn. And sometimes as a parent, stuff is not optional, is something that I've learned, unfortunately, is that you want it to be cooperative, but sometimes it's like, no, we are going to the driveway now, and I am showing you how to do something on the car. It's like, not everything can be like
that
causes
and fight. Like if I'm.
Oh, I'm sure. Yeah.
If I'm ever asking anything beyond basic chores, like, hey, make sure that your room isn't full of trash and food attracting insects and stuff, and can you please put the dishes away and stuff like that. Anything beyond that causes fights.
Yeah, I feel like if you want to hit the angle where you're like, let me explain to you why this is a necessary skill, and you only have to do this once. Like learning how to check the oil, you kind of only have to do it once. And then you know how to do it forever. And it only takes 10 minutes. And that 10 minutes is time where you can chit chat. So yeah, I obviously respect how difficult it is to try to get them to do things. But like, it's like there is the one side where you're like, I'm going to gently explain to you why this needs to happen. And then there's the other side that's like, I am going to miss you when you leave, and I need you to learn this so that I feel good about you being safe and like able to handle situations when you're outside of the home. So like maybe you need to express some of your feelings about it too. Like, hey, it bums me out that you don't want to hang out with me, and all I'm asking is for 15 minutes. So can you give me 15 minutes, and then you're going to be gone for like months on end, and I'm not going to see you. So yeah, I would say maybe bringing the feelings element into it would help a little bit too.
That might, yeah. I've been very. I mean, I'm pretty reserved with my feelings in general. I've not learned. I grew up Mormon, super white nationalist upbringing, very misogynistic, and a lot of my later adulthood has been trying to learn how to unpack that. But I'm still not really good with just like sharing, this is how I feel right now.
Yeah. And it
you
doesn't
could
have to be
even-
complicated. Yeah, go ahead, Ben.
Yeah, and you could even say like, if I just kind of get this off my chest now and know that you know how to do this later on when you're in college, I'm less likely to bother you randomly and make sure that you know these things. It's like you'll have give them the. It seems inconvenient now, but it's more convenient than you calling them every so often. Like, hey, did you remember to check your oil? How's your car doing? Are you safe? Like, they might be more annoyed with like a weekly message about that.
Yeah. And they won't need to ask you. You know, there's some skills stuff that's like, I would say equip your kid with a basic tool set if they don't already have one, because they're going to want to hang pictures in their dorm or whatever, or their first apartment or what have you. And being like, okay, here's how you use a stud finder. Here's how you hang the pictures or the posters or whatever it is that you're trying to do. So like just little practical things like that, where they won't have to call you or they won't have to Google it and figure it out themselves. You can impart that skill to them and be like, look, this is valuable and you won't have to call me later. And I appreciate having a little bit of time to spend with you before you go off to college. You don't have to get too in depth about it. Just being like, listen, I really value the time that we spend together and I want to get as much as we can before you leave the house,
Yeah.
Yeah, I think summer break's going to be a really good opportunity for that once school is done. And there's there's going to be a good like 2 months between school ending and him turning 18. So I think like that's probably a really good time frame to just be like, hey, let's spend some time together. But I got to try and find a way to do it that's not seeming forceful, like perceived as I'm making him do it.
Yeah. I think the vulnerability aspect will help with that a lot. Like, look, I need to spend some time with you before you leave. I will say right now, that kid is stressed because I am trying to go to college later this year, and I didn't realize how many things you have to do in the springtime to make that happen. I would have been so screwed if I had waited until now to try to figure that process out, because I had to, there was a deadline for applying for scholarships and everything. So if your kid is going to college in the fall, they not only are dealing with senior stuff of like, oh, I've got my finals and graduation's coming up and everything, but also I have a bunch of shit that I have to do for the college thing that's not even going to happen until several months from now. So honestly, I think that it'll probably clear up a lot during the summer break when like the pressure is off and they can just like rest. And then it doesn't feel like your demand on their time is competing with a bunch of other stuff that they have to do right now.
Yeah.
Yeah, that's a good idea.
Yeah.
Good insight.
Well, Dave,
thank you. Both of
we
you.
appreciate your call, and I hope that things go well. You know, it's like your last summer with your kid before they go off and do their own thing. So I hope it goes well, and that you find some good ways to spend time together.
Thank you both. I'm tearing up a little bit, so now's probably a really good time to
write down some of your vulnerable feelings so that you can prepare them for later. it's the perfect time for it. But thanks, Dave. We appreciate your call.
That's a good idea. Yeah.
Yeah.
All right. Thank you.
All right.
Yeah. We'll talk to you later.
Dave.
Bye.
All right, bye.
Bye.
Okay.
All right.
Lines did open back up for a second there. Did we get another call during that time? I don't think so.
I'm waiting for a
same.
spicy one. Like 6
We want a
advice
spicy
calls
one.
popped in immediately.
Oh, yeah.
And I was like, I'm sorry, guys, but not this late in the show.
Yeah, it's pretty much the whole rest of the show at this point. So we do have a space for one. If you have a disagreement with us, we have space to take at least one more disagreement call before we switch over to super chats. But just now, the poll has gone up a few minutes ago. If you want to vote on which position the loser has to defend. So we do a little game with our super chats, $5 or more on the super chats, and we will read them. And if you vote #Lux or hashtag Team Lux or hashtag Team Ben or some variations thereupon, hashtag is necessary, then the loser of that little competition has to defend a silly position for 2 minutes at the end of the show. Right now, you can vote on what that position is going to be. So, number one, Harry Potter gives you brainworms. or The Draft, but for drag troupe, or MAGA has queer envy. So there's a poll in the chat, and you guys will be able to decide which position we have to defend at the end of the show, and you guys decide who has to do it with your hashtag Team Lux or hashtag Team Ben jokes, or not jokes, votes. I'm losing my fucking mind. I worked out immediately before this. Yeah, get your jokes in.
Get your jokes in your super chats.
Yeah, where's Aliashana Silverbow?
Yeah, like we will read jokes if they're a super chat of $5 or more. So if you want us to read your jokes, that's how you do it.
Exactly. Oh, there's an overwhelming winner in the chat, at least in the horizontal chat right now. So that's going to be fun.
Yep.
But yeah.
All right.
Ooh, we had a person call in. Okay, that's going to be an advice call. So I guess we just keep taking them in order.
All right. Let's talk with Sean, him from Kentucky. Sean, you are live on the line with Dr. Ben and Lux. What would you like to talk about?
No, I'm not sure if it would be advice because I don't have any personal stake in it anymore. It's just personal experience and how that's informing my seeming difficulty in being just a staunch ally.
Mm-hmm.
So, when I was young, I had sort of a fascination with being a woman. But when I tried talking to my mom about it, despite her being liberal, she also grew up Catholic and basically just shut me down. It's, stuck in my head for a long time, but I don't really feel a way about it. I also don't feel like a man. Like, I don't know what people are talking about when they're saying they have a gender identity. So while on principle, I support, transgender, I'm in there as, a psych person. So I understand, altered mental state and how that would affect your life and needing to try to fit that lifestyle as best you can. But I don't understand it, and it confuses me.
That's as far as me.
I feel like I should have, enough experience to have some empathy, but it's just confusing. And anytime I think about it, I feel very off. I feel very concerned. It doesn't help that some of the transgender people I have met fit the scaremongering stereotype. So it's a bad time all around.
I'm struggling with how to tackle like a very nebulous feeling of discomfort that you're having. Cause I'm like, I don't know really like where it's coming from. I don't feel like you have helped elucidate that. And I'm not trying to be critical. I'm trying to find where is the place that I can come in and start addressing the concerns and stuff. So I guess I'm just like hoping for more specifics. Unless Ben, you have a response already.
So, I feel like a lot of this was sort of addressed earlier, but it is like a specific oddity with me because I feel like it was a coin flip, So if I hadn't even talked to my mom, I could very easily have, continued staying fixated on it. I can say that I hate a lot about what being a man means. So I get it. But when I think about how people specifically address this, the medical side really concerns me. Because had my mom not shut me down, and had I, reconsidered it later, the idea that I would even just temporarily shift how I grew up to that degree scares the hell out of me. So that's where I'm coming at it, really. That's my biggest concern.
We were talking to another caller earlier about like the fact, like you go on the medicine and then you will usually know within a couple months before any noticeable physical changes have occurred. So I don't know what's so scary about the idea that you might have pursued something that may or may not have worked out for you. Like that you could try something out for a couple months and realize it's not for you, and that represents a scary concept. I don't really understand where that's coming from.
Okay. I was hoping I could leave this out because I don't feel it's relevant, but the way you've put that makes it relevant to me. I'm bipolar. I've used a lot of psych medications that radically shift my personality, and I don't know how much of what makes me me. And I think that's the biggest thing that, neurodivergent people would bring into this. So how much is my level of, sex assigned hormones part of my personality? And how could that have shifted my life had I gone through with that? That feels really big.
Yeah, but this ties into the broader question of like, is free will real? Which sounds maybe a little bit like a jump, but it's like, what causes us to do anything? What substantiates our personality in any context? Like, what influences create like the different aspects of our personalities and everything. And I don't want to try to minimize the difficulty of having bipolar disorder, and like the medications that they put you on are fucking crazy. Like the idea that we put people on lithium is wild to me, but it does help people. So, but it's like scary to me that's like a really intense form of medication that can cause like really big problems for people. But yeah, so it's like, but where does any of it come from? And I think that this is one of those things that sometimes prevents people from even pursuing mental health care, where they're like, but it'll change who I am as a person. Like, but what if it changes you in a way that makes you more functional and happier? Like, what's scary about that concept? Like, you're on medication for bipolar, I assume, or you've been on medication for bipolar. So like, that medication helped improve your quality of life, I would assume, right?
Sort of. I mean, that's part of my experience that makes me scared of this. I mean, some of the medications that they put me on basically nearly took me out. So I don't psych meds and it to, I don't know, a parallel degree, this kind of medication feels like such a huge change to the parts of us that make us us, that it could do things. It, like, psych meds are scary as hell. I tell people that have their own problems.
I think that there's maybe from your end a little bit of, it's fair to bring your experiences into this and to have hesitations with certain medications because of your experience with mood stabilizers and other medications for bipolar. But these are different medication categories. And I think it may be difficult to separate those out. But what the bipolar meds are doing for you is not the same thing as what HRT would do for you. And HRT is not a brain-altering substance in the same way. It's not something that's going to change who you are. It's going to change certain parts of your body and may make you feel more at ease. Whether or not that's compatible with the person you are, and if that's the direction you want to go or not, that's, I can see where you may be having some struggles determining that. And with your particular situation, this is where we get into some more of the nuances. With a lot of people, I'd say, yeah, just like go for it, just jump straight in, like go talk to a provider, you can start hormone therapy, all that stuff. For you, I would say more caution is probably warranted. I would say talking with a multidisciplinary team to include psychotherapy, to include psychiatry, and whoever would be doing hormone therapy, all of those people, I think be open with them, be honest with them about how you're feeling, what your fears are with it, what's leading you in certain directions. I think all that is very fair discussion. And I think you just need to be a bit more calculated about how you go about pursuing a particular direction. And I know that may seem a bit less helpful, but without knowing specifically what medications you're on, and I'm not a psychiatrist either, so I don't know all of those nuances of how do those medications impact the absorption of HRT? How does it impact the way it's going to work for you? And so I think it's something that you should continue exploring I think continuing to address the questions of who am I, what things do I like, who do I want to be in public settings, who do I want to be in private settings, all that is fine. And you can jump straight into that on your own. And then just with the medical piece, getting a team more involved in that, I think, is appropriate.
Well, I appreciate that as genuine advice. Like I said, it's not it's not a thing for me. Like, I do consider a lot, like, as a historical data point, that had my mom not been still as Catholic as she was, that I might have a very different life right now. But I don't think it's something that I can really just do. Like, I think my biggest thing here is that I don't have like a personal idea of what gender is supposed to be. Like, I have a lot put on me as a man for what being a man is, but I also have the choice to say fuck all them people. So it feels, both from what happened with my life and in general, very arbitrary, though I know for other people it matters a lot, but I don't know how to get where they are.
And you don't have to necessarily. You might, like, people have different levels of how much gender means to them or how much they identify with a particular gender. I think the majority of people have a pretty strong sense of gender, and so that may be where you're feeling this pressure to identify with one or the other from. But there are people who don't identify with gender at all and don't see why people would think that. And there are also some people who identify with multiple genders or have more fluidity in their gender identity, and all of those are valid as well. And I'm probably not the best person to advise like how to navigate that because I don't experience it that way. But there are people out there, and they're just a bit less talked about in the media and in the general public. So I would recommend, if you know people in your area or you know communities of people, especially non-binary communities may have more people who identify with what you're describing. Might be worth talking to some people and seeing if your experiences line up at all, because it might just be that gender's not a big deal for you as it is for other people.
Yeah, like there are words to describe like an alienation from gender, period. Like the word agender is like basically a person who has no strong attachment to any particular gender, and maybe doesn't have very strong feelings of gender dysphoria or whatever. I have several friends who are like non-transitioning, agender, non-binary people. But also, and I'm not trying to pressure you on this or anything, but I'm hearing a lot of echoes of what I've heard a lot of trans women say before they finally try hormones or before they start exploring that aspect, where it's like that sort of I could take it or leave it feeling that you're describing could be a type of dissociation from gender dysphoria. Like, I know somebody who she was experiencing depersonalization and dissociation, and then she, like, her doctor recommended hormone therapy for her, and she started it, and like within a few weeks was no longer experiencing those. Anecdotally, I saw someone in the chat earlier say that they were diagnosed as bipolar, and then when they started transition, they no longer needed to be on the bipolar medicine. Like their body like regulated itself. So I'm not trying to say that that's like what's going to happen to you or anything, but like I just want to flag to your attention that what you're saying is quite familiar to me from people who are just like in a despondency area of experiencing gender incongruence that is not always clearly identifiable as gender dysphoria until you're out of it. And then you're like, oh no, that was a type of suffering that I was experiencing. And I'm especially concerned that you're like, well, I would have probably pursued this, except that I had a strong backlash from a family member. Like that's indicative to me that like it probably is something that is worth talking about with a therapist at the very minimum, and like an affirming therapist who's going to encourage you to explore that, rather than like, you don't need a person who's going to shut you down because you already have that in your life. You know, you need somebody who's going to facilitate a very robust conversation around this and kind of help you tease out what's going on specifically. Because it's obviously like something you're still thinking about, even though this conversation with your mom happened a while ago. So yeah, I would just encourage you to talk to a therapist about it and consider it on your table of options that like life is okay right now, but life could be better in a very particular way if you were to pursue that and if you were happier that way. Or you could just embrace having a non-binary identity and not transition and just be like, yeah, I'm agender. I just don't care about any of this gender stuff and I'm going to do whatever I want to do. If I want to be feminine in this way and masculine in this way, then fuck it. And like maybe your gender journey is going to end with you being like, I'm a man who sometimes is slightly less than fully masculine because you don't like various pressures on manhood. I'm just basically saying like wherever you land on this, I encourage you to explore it further.
I appreciate that. I have a lot that just makes this very confused. I mean,
yeah,
to a certain extent, this could also just be masking. I mask. That is part of my personal life. So maybe I just am a man now because I've been masking like this so long. You may I see your point. I see the connection. It is something maybe if I can get back into therapy, which I'm sure I'm going to, that I should talk about it. But I don't know. It's like I said, it makes my ability to support the movement or whatever you'd call it harder, because it makes a lot of what I think feel in conflict despite wanting to just be in support. Like I hear a lot of people talking about gender, and when people are bringing up masculine and feminine, to me that just sounds sexist, like strongly. And it was just like, why would being masculine be this and being feminine be this? I thought we got over that. Like, do whatever the fuck you want.
Well, those pressures still exist in society, right? And there are trans people who transgress those norms. Like I know trans women who work on cars and have dirty, short fingernails and stuff, and they play softball and things. So it's like, even within trans community, there is gender nonconformity, right? And like there are people who, for survival or for acceptance, they lean hard into those stereotypes because that is the language that our society uses to help communicate information about ourselves. So like if a trans woman is wearing a giant padded push-up bra, it's because she wants people to see that she has a feminine body trait. And maybe she's wearing makeup, which helps signal that she is a woman and it helps her fit in. And like maybe there's a trans woman who doesn't give a shit about any of those things and she changed her body and she feels happy with her boobs, but she wears a sports bra because she's got practical things to do in her life. Like, I don't know. But what I'm trying to say is, yes, we navigate those stereotypes and that sexism to be safe, like, and to be accepted.
Sure.
So it's, we're just trying to navigate a lot of like pressures. And I hope that, knowing that there are so many gender non-conforming trans people can help you kind of lean away from that stereotype thing, or like to see that stereotype thing through a different lens of it's just a survival tactic and it's a communication tactic. How do we communicate to people our gender if you can't access hormone care, for example? Like you're going to use all of these other signals while you're in the middle of trying to navigate the medical system, and that stuff is useful at certain times and it can be harmful and restrictive at other times. And trans women experience the same pressures that cis women do to perform gender in a very specific kind of way.
Right, and even mentioning the medical system, there still exists a lot of pushback against trans people who show up to their doctor's appointments to try to get gender affirming care, and if they don't look trans enough, or if they don't look like they're a certain way, then they can get denied their health care.
Yeah.
So, and I've heard Katie Montgomery talk about this a lot, especially in the UK. There's a lot of pressure to do it that way. They're like, they'll talk about, I have to wear a dress to my appointment because otherwise they won't take me seriously.
Yeah.
So I think when we look at activism and allyship from this standpoint, I think it's easy to find areas where our subset of the community is underrepresented and to feel like other people are doing it wrong. But it's a yes and conversation. It's like, yes, we need more representation from my side of the community, and these other people that are doing it differently are also uh, being allies, and they're also needing support. So I think too, if you kind of dial in more on your own identity and start, like, let's say you do start embracing an agender or non-binary identity, I think coming to terms with some of that makes it easier to support other people's method of advocating for themselves. So I mean, think through that a little bit.
Sure. I mean, that's very fair. And honestly, I think a lot of the discussion and concern that a lot of people have, there are plenty of people that are just going to be against it forever. But I take solace in the fact that when they caught Donald Trump in a moment where he wasn't really thinking about it, and they asked his opinion on transgenders in a theoretical future where we can just take a pill and switch, he was just like, yeah, who cares? Like, that sounds fine to me. When he realized it was a point of grifting, he decided to latch on to, them as the enemy. But he did, when just asked offhandedly, it was just like, who would care about that? And I think a lot of people would stop caring if you could just go in, take a pill, and you're flipped. But that's far in the future and probably magical thinking.
Yeah.
That's the thing, though, Sean. It's if there was a button you could press and it would just do all the things and you could just be whatever hypothetical in your head you have. If you would press the button, that's important information for whether you should pursue it or whether it's interesting for you to pursue it. Because that's like for a lot of trans people, that's the moment where they're like, oh, if there was a magic potion that I could take and just like have a Shrek transformation, and now I've gone from an ogre to a hot, sexy dude. Would I take that option? I can't believe I just fucking referenced not the first Shrek movie, one of the Shrek sequels. That's crazy. Anyway, so I hope that helps you, Sean. I really hope you get back into therapy soon because that can help kind of sort your feelings out on this. And wherever you end up at the end of that process, I think you're going to be a more fulfilled and rounded person, because even if you choose to be a man, you'll know that you really chose to be a man, and that was like, you have agency in that, and it's not just something being inflicted on you because your mom refuses to accept whatever. But with that, we do have one more caller, and we're going to move on. But thank you so much for your time, and we appreciate you.
Yep. Thank you, Sean.
Absolutely. Thank you for having me on.
Yeah.
Hey, bye. All right. Let's get to Cameron. Him from North Carolina. You are live on the line with Dr. Ben and Lux is dancing, excited for this call.
I have to move,
what
or
would you
my
like to talk
watch will
about?
tell me that I have to move. I got a new watch, and it's like, you've been sitting for too long. And I'm like, I'm literally standing. Anyway.
Yeah. Hey,
Cameron.
how y'all doing?
Hi, Cameron. How's it going?
Pretty good. So I called last week about the distinction between the mind and body, and I've given it a little more thought. And I've came back to discuss the idea of just identity in general as just a construct. It seems that there's a lot of conception that identity is some expression, or it's at least expressionary. And I think that in of itself seems to self-pathologize quite a bit. The being of the body, and to almost problematize and make an issue of the body as it is, at least as far as the trans issue is concerned. So I'd like to have your thoughts, because I initially called in about the medicalization of the trans issue, and it seems that medicine attempts to treat surface issues that are involved with that expression, and that is used to create a more like stable identity, and that seems to just be just a harm overall. Just because dysphoria and depression or just stress, anxiety, these are just healthy expressions of of human behavior. That
Is it healthy to be
So
suicidal, Cameron? Is
Yeah, so-
suicidality healthy for a person to experience? That's a silly thing to say. That depression is like a healthy express. It's by definition dysfunction. It's when people cannot do their activities of daily living, when they can't take care of themselves. That's like definitionally dysfunctional.
Yeah, and I want to clarify here, Cameron. So the medicalization is not for the gender identity, right? The identity is just your sense of self and who you are. The medicalization is for gender dysphoria, which is dysfunction. And I have some thoughts about kind of the nuances of medicalization and to what degree do we need to medicalize things, because that is a legitimate question. And that's one that we're seeing with neurodivergent populations as well, is how much are we granting this a status as human variation, and how much of it do we need to medically intervene on? And if so, how do we allow for insurance coverage, diagnostic criteria, et cetera, if it's a human variation versus a pathology? So that the language can be very nuanced and debatable here with this. But as far as reducing all of this down to, like, I think there's a problem when, like Lux was saying, when we reduce all of anxiety, all of depression down to normal human levels. And sure, there are normal human levels of anxiousness, of having depressive mood, or having different like changes in your emotion. That's different from the disorder, the clinical disorder of anxiety or depressive disorder. There's a reason why we label it as anxiety disorder and not just, like, we use the term anxiety as a colloquialism to be short for anxiety disorder a lot of the time. And so, like I was saying, the emphasis on where we're having dysfunction is kind of the key thing for when we determine this to be diagnostically relevant versus benign human variation. What are your thoughts on that?
Okay, and I don't mean for this to sound like a gotcha or anything, but a pragmatic transition, like like you're saying, as far as treating dysphoria, is that not in some way, at least by the DSM-5 or any other just current medical understanding, isn't that a treatment of some sort of delusion of sorts?
No.
It's treating the distress, like the distress associated with gender incongruence is resolved by resolving the incongruence. So if you were born one way and you want to be perceived another way and you fix that problem, then the problem is resolved.
Yeah, and delusion has a specific definition. So calling something that you disagree with as a delusion is not really helpful. So like a delusion has to be a disconnect within your perception of reality. No, delusion is a misperception of reality. And like I said in previous calls, gender dysphoria is not a result of misperceiving reality. It's an accurate perception of your body that is distressing to the identity of the person in your brain, which is not the same thing as a delusion.
That's why I said earlier that in general, I believe that all pathologies of sort, depression, stress, anxiety, even things that have a more defined basis, such as the previous caller with bipolar, or even maybe schizoaffective or schizophrenia. These are just definitions that we apply onto behavior. This is something that over time.
Not every. I think it's problematic as well to label legitimate conditions as behavioral, which is why I kind of have a lot of pushback when people define things as like the name change from like mental health to behavioral health, because behavioral health emphasizes your actions and doesn't really imply addressing distress.
Yeah, like schizoaffective
so
disorder is not a behavioral disorder. It's a disorder of like things happening in your brain that are not actually happening.
yeah, and I think
I
again
agree.
you're missing a very
How is
important
that
component,
defined?
that there's a spectrum
How is that defined
of
medically?
abilities, and there's a spectrum of distress with these conditions. So like, yes, people have anxiety at baseline. That does not mean everybody has a disorder. And so the definitions are important to establish that spectrum of when do we decide that this is a disorder and when do we need to intervene. So, I mean, you could look at really anything in reality of just being a natural thing that happens to humans. You could make the argument that a heart attack is a natural variation of something that happens to humans. However, it's not really compatible with life. And so at that point, we decide that we need to intervene because they're not going to live long if we don't. So that distinction is important.
I mean, this is where I actually think that the pragmatic approach to dysphoria is the most appropriate one. I think that the problem I have is the over rationalization, or what seems to be an over intellectualization of the whole process as being something that is grounded in this self-construction kind of belief system that, I mean, the narrative evaluations of identity are simply, they're limited culturally and linguistically and technologically. I mean, transition itself.
Cameron, it sounds like you are over philosophizing. Cameron, you're over philosophizing something that really just has day-to-day utility. And we could talk ad nauseum about the different psychological theories of your identity and sense of self and where that comes from, where does gender come from. There's a lot of people who love to have those deep philosophical discussions. But the problem is, how much do we go down that rabbit hole before we start making decisions about day-to-day life that impacts real people? So, and that's where we're losing you, because whatever that is, wherever we get our sense of self from, whatever that big rabbit hole leads to, does not really change the fact that gender affirming care does allow people to live longer and live at a better quality of life and have demonstrably good outcomes for the majority of people.
It's like wild that you're saying, oh, we're like overcomplicating this and we should be more pragmatic. I'm like, literally just give people the medical care that they want. Like, that's the most pragmatic approach to gender dysphoria, is to give them the 99.9% effective form of treatment.
I'm not pointing to anybody. I mean, when you say we, I think this is more of a within one's own mind. Like, I'm not
Cameron,
saying this as
may I ask you a couple questions?
Please.
Are you a psychologist?
No, I am not a psychologist.
Are you a doctor?
I am not a licensed doctor.
Are you a researcher putting together papers and publishing on these issues?
I am not. However, I am a critical evaluator.
Why the fuck should I care about your opinion that drastically differs from the consensus of evidence? So here's the thing: like, it's okay to be self-taught Cameron, it's okay to be self-taught on issues. Cameron, no, I'm not saying that lay people can't give opinions on things. However, your burden of evidence that you have to bring to the table, the level of discussion that you have to give us in order for us to take your opinion seriously, like, you still have to meet a pretty high bar.
Okay.
So
all right.
The fact is,
been a lot of
especially when your opinions are about whether or not people should be treating mental health conditions in a certain way or treating gender dysphoria in a certain way. Number one, you're not doing those things. You're not on the ground helping people with these issues. You're just sitting back from your armchair saying, well, this is how I think people should treat anxiety, depression, gender dysphoria. Well, like, who the fuck cares what you think? You're not doing that. You're not making these diagnostic criteria. You're not involved in the research. But okay, so you're engaging with this as someone who's self-educated. That's fine, Cameron. No, it's okay to self-educate, but the information that you are bringing to the table needs to be equally valid as the stuff the researchers are bringing to the table. And if you disagree with that, with those researchers, you need to clearly state why and give some citations, give some evidence, give something to back up your perspective, because all I'm seeing is somebody trying to analyze something that he knows nothing about.
I'm not attempting to, I guess, debunk or anything. All I'm saying is that this comes down to where I think. Excuse me. I let you speak.
No,
please
Cameron.
let me
but
speak.
Here's the thing. No, because you're giving opinions on what healthcare somebody else should be able to access. So I care.
I did not say that. I said that these things are over
You said
pathologized.
no, Cameron. Cameron,
That
you may not have
is an assessment of the medical access situation.
Yeah, you are saying how people should treat gender dysphoria, and you saying that we should rely on a certain approach is you giving a recommendation for how healthcare should be administered. So you have to demonstrate why the fuck I should listen to you.
You keep saying
medicine itself.
Cameron, you keep saying we're medicalizing it, but it is a medical condition with a clear medical approach to resolve the problem.
You're not listening to me. I'm saying that evaluation that medicine works is not described within medicine. So you can't appeal to that.
What are you talking about?
Explain.
Dr. Ben is a literal physician who's telling you what the medical guidance is for treating this medical diagnosis. He can outline for you the medical criteria for getting the medical diagnosis and then getting a medical prescription and resolving the medical problem. Like, it's so weird that you're like, oh, we're medicalizing this medical condition. Like, yeah, no shit.
I mean, we treat, when children say, I think I'm, not the gender I was born at, I'm trans, we treat it as like fire in a movie theater. I think there's a very quick impulse.
You have not been listening at all to the show.
Tell me what's wrong. And that, excuse me,
It takes years of multidisciplinary team working together, and the parents have to be on board. We don't treat it, we treat it like a fire in a movie theater in the sense that it needs to be addressed, because this can spiral out into a much bigger problem for the child, where the child is not showering, the child is, suffering in school, their grades are down, they're not participating in extracurricular activities, they're withdrawing socially. Like, it can become a significant problem for living your life in a healthy way, right? But I want to be clear, that does not mean we fast track children onto the medical treatment, right? We need a therapist, we need a doctor, at least one doctor involved, usually more than one when we're talking about children. So it's like, yeah, we treat it like a serious problem because it is a serious problem, but that doesn't mean that, we're fast tracking anyone. Like, in fact, like, what is it? Like 99% of kids who go on puberty blockers are then going on to cross-sex hormones because the bar is so high to get on puberty blockers in the first place. We only let people on puberty blockers who we are like basically 100% sure after years of examination and observation that they are consistent, insistent, and persistent, and that they will go on to do cross-sex hormones. So you have this concern that is just unfounded, and I'm like trying to be respectful of the fact that the whole narrative around this contains so much misinformation, but it is really frustrating that your entire thing here is just like, I don't know things, and therefore my opinion is that we shouldn't be doing them, and you're a voter.
That's not correct. That's not correct. If honestly, if I could say anything, I think that the pragmatic approach is, like I said previously, it is the most appropriate approach. I think that the rationalization, it's all post hoc, it's all after the fact. Like explaining, I used to dress up in my mom's high heels and things like that, to like explain a history to your doctor
People
That's
say
not-
that because it used to be
again,
the
these are
medical
all
requirement.
after-the-fact
It used to be, hey Cameron, it used to be medically required that you had to have had gender dysphoria since you were a child or they wouldn't let you have any. So like people are like, "Oh yeah, well, if I tell them, "Oh, I didn't realize that I had this problem until I was 23," they will not give me the medicine. Then that you have no choice but to tell them, "Yeah, no, I totally knew when I was 5 and I wore my mommy's dress and I stole her shoes." Like that's the medical system creating a gatekeeping problem that necessitates people adopting to a narrative or they will be denied care because some cis person arbitrarily decided, oh, you need to know by the time you're 5 years old or we're just not going to treat you. It's like, you know that like ADHD is also kind of hard to get diagnosed if you're an adult, but if you were a child who was being neglected and you didn't get diagnosed as a child, how are you supposed to get that diagnosis? Like if they're like, oh, we only give it to adults who were also diagnosed as children, right? Like this whole system necessitates those narratives that have cropped up. But we are at the end of our time for today. So I'll let you have your closing statements, Ben and
but
Cameron.
You've glossed right past that, and that's actually the problem, is that because we intend to create some sort of narrative to explain behavior.
I muted him because he's just saying more nonsense that is not relevant to his argument at all, and we have to move on.
Yeah, we got to get to the super chats.
Drop you, Cameron.
Cameron, we will talk to you again in the future. We appreciate you.
He was just bringing up the thesaurus and saying some words that he thought sounded kind of big to facilitate his argument, and it was not carrying the water he thought it was.
Yeah,
that
frustrating.
That bothers me so much when people like I don't have a problem with people wanting to talk philosophy. Like some people love that. I don't. Some people love it. But my problem is when people try to be these armchair philosophers and then use that to make medical decisions for people or talk about what bodily autonomy somebody should have. And like, no. This is not how you make those decisions. And so I get a lot of pushback too from people saying, well, you can't just say, well, they're not a doctor, so they're wrong. Like, no, that's not my argument. My argument is you are making the bridge that I think this thing, therefore, this is how doctors should treat people, or here's what healthcare should be available. And that is a medical decision that should require a license to make. So,
yeah,
that's why I use that.
Well, with that said, we are on to the super chats portion of today's show. We're going to have to be reading them from off screen for the first part. There was some fucky wuckiness with the tech stuff. My apologies, everybody, for that. But we are going to read your super chats. Are we just going to the fan funding page here?
Yeah, I mean, I can do it if you want. If you guys want to do the fan funding, you can. And I can just stop you when we get to the place where we have super chats to read.
Sure. Oh, yeah, we're going to have to kind of... I'm just going to focus on the horizontal. Well, okay, there's a way fewer of them in the vertical feed, so let's knock those out on the vertical feed, and then we can switch to super chats on the horizontal.
It's the second one from Mira Featherbender where we start having access to them, so you can read up to those, and then I'll catch you on the horizontal one.
Cool. All right. Well, with that, $10 from Mira Featherbender. Thank you. Says, thank you again, #team Dr. Ben, for your video recently with Katie about the trans medicalist trans woman. IDK, how y'all cope with those kinds of attitudes and other crappy views so frequently. All my love. Thank you.
Oh, yeah.
It's
it was
hard.
a line clip from a few years ago. And I know people or my comments saying, oh, Katie's back. No, Katie's not back. That was an older clip.
Digging from the ancient vaults.
Yes. Jimmy, in all fairness, Jimmy told us that we should be sharing clips. So I'm doing what I am told. And so I did. Next one. Already just the super chats, not the channel memberships.
Yeah, just the supers. Yeah.
Okay. $10 from Audrey Marie. Y'all, I work in harm reduction and drug user health, and things have been bleak lately. It meant so much to hear y'all stand up for harm reduction and decriminalization. Made me tear up. Love TACIS and both of y'all. Thank you so much. And yes,
thank you.
100% agree.
Yep. Thank you, Joanna, for their $5 Australian monies. Chloe Cole's detransition doesn't make sense. Story and timeline changes, also promoted by the people who drafted Project 2025. Yeah, like Chloe Cole is funded by a billionaire who is behind the takeover of our nation. So, you know.
Love that. $5 from Mira Featherbender. My egg cracked with gender euphoria. My dysphoria began when my HRT had to stop for medical reasons. #team Dr. Ben. And thank you for your vote. And yeah, gender dysphoria, euphoria can be fairly complex.
That's
I'm sure.
we're caught up to where I can access them on the vertical. So now if you want to go to the horizontal and read up to, I think it's Sleep Near 8.
Okay, and then we'll be able to put them up on the screen.
Yes.
Okay.
Cool. All right, thank you for the 5 quid from Mabs, who says, woohoo, first here. Boy, am I sad. Well, I hope that you're feeling less sad now that we've gone and had some good conversations. Oh, by the way, everybody, don't forget, we're doing Calling It Now after this. I'm going to be on with Jimmy for 3 more hours, so stick around for that.
Yay.
Yay.
$10 from Ash Ashandre. Please disregard if I misheard. Lux, I heard you describe yourself as queer, non-binary, trans, handicapped person. Will you enlighten me how someone can be non-binary but trans, please, if true?
I would never describe myself as handicapped. I am disabled. But yeah, trans just generally broadly means like identifying with a gender besides the one that you were assigned at birth. A lot of people assume that transgender requires you to physically transition, which it doesn't, but I have done that and probably will do more. So yeah, non-binary, like by definition, I know that some non-binary people are not comfortable calling themselves trans, especially if they don't want to seek transition. But my definition is very broad on this. So yeah, I'm non-binary and I'm trans for multiple reasons, and I'm disabled. Thank you for your question. Squirrel Knitter with the $5 says hashtag Team Lux Yellow Heart. Thank you. Thank you. That's a Simpsons heart right there.
Katie Iron Fist. RFK Jr. just wants the teens to look like leather handbags like he does.
Yeah, and we're going to get like a little garbage disposal installed in our throats too. It's going to be amazing.
Yeah.
Thank you. Is the Sleep Near, is this one where we can transition to the hashtag Team Ben one?
Is it the $50 one from
No,
Ben?
I'm looking at a $5 one.
No, okay, yeah, it's a $50 one.
It's a 50. Okay, cool. So $5, Katie, they mentioned at Katie Iron Fist. Oh, because you forgot maybe in a previous one. Shit, hashtag Team Ben. I got you, fam. Hashtag Team Ben. Oh, Katie forgot to vote. Okay, thanks, Sleep Near. We appreciate you.
Sleep Near's giving a Team Ben. Thank you.
Yeah.
We will accept gift votes if you want to super chat so you can gift vote somebody
on someone else's behalf.
Too.
Yeah.
Yes. £5 from Babs Barrett. There may be transphobes ahead, but while they're all brain dead and music and love and romance, let's face the music and dance. Hashtag Team Lux.
I feel like that's a reference to something, but I don't get it. But thank you. Appreciate the 10 Canadian units from Where is Waldo, who says, it sounds like Jordan is here in hopes that he can reaffirm bigots watching with lying propaganda and didn't expect 2 trans people, one of whom is a doctor, to catch how ignorant he is. Yeah.
Yeah.
That was our 12-minute call. Wow. I really fully just came out and like one of the first callers being like, you are a dumb moron. Doesn't happen very often.
Getting straight to the point.
Yeah. Yeah, for sure.
$5 from Joshua Everett. I care about kids so much that I think we should only give them treatments with known worse outcomes. Jordan, essentially. Hashtag Team Dr. Ben. Yeah, basically.
Where's the lie? Where's the lie? Okay, I think we're caught up now. We got a $50 donation from Sleep Near. We should be able to transition, to having them on the screen. But yeah, I'll read that one. Thank you, Sleep Near, for the $50 dono. That is super duper generous. Thank you so much. Oh, we're doing it this way. Okay, I see what happened. Thank you for defending the children. I was born in 84, realized I was trans in my teens. It took 20 years to overcome the 90s stigma and growing societal acceptance to finally transition 4 years ago. Loving life now, but what I'd give to have had puberty blockers. Truly, people don't like think about the 90s and how bad it was, but like it was really fucking homophobic in the 90s. Like, and like by extension, transphobia and like the AIDS scare was still very much present in people's minds. I'm going to pick you up again if you aren't careful. But thank you for the very generous donation. We appreciate you.
$10 from Ashandere. I feel like most of the anti-T men are just afraid to take a beautiful woman home and then find out she hasn't had bottom surgery. Sigh, censorship. So insecure in their own love lives. Yeah, a lot of the time.
True. I don't know why it was missed, but we had a $5 from Fern in the Forest in between those two that said hashtag Team Lux, type message here, soup brain. Sorry guys, we're transitioning onto new systems like on all of the back end, so
it also,
it's a little bit weird right now.
Something really weird happened today that's literally never happened before. Both Jimmy was parsected to my computer for like 20 minutes trying to solve it, and neither of us had any idea. So we were like, okay, let's get the system rigged up enough to be like half functional to carry us through. So sorry, we read this one that's on screen, right?
Yes.
Yep, just read it.
Okay. Thanks for keeping an eye on the ones we missed, Lux.
Yeah, I'm just still reading off of fan funding because this is really tiny and I don't want to struggle
Who's
to
this
read.
guy?
Who's this fucking jamoke?
This
jabroni. Get out of here.
Love it, we didn't even read it.
Yeah. Thank you for $10 from Legally Mod, who says, I got my first treatment for autoimmune alopecia yesterday, over 20 steroid injections under my scalp. It might be too late to save the hair I currently have left, but my hair should grow back. That sounds intense. That's a vote for hashtag Team Ben. Damn, I hope that things are going well with that.
A lot. $50 from Infidel. Thank you so much for your generous donation. At first, I was upset because I couldn't donate to the fundraiser. Then I remembered TACIS is an amazing cause. Well, thank you so much for supporting your, I guess, not so local trans people.
Yeah. Infinidale, you did a big donation already to the fundraiser, which we appreciate. And on Calling It Now, we are graciously foregoing our usual income of super chats, and we will be pointing Calling It Now at the fundraiser. So if y'all stick around for 10 minutes and watch me and Jimmy argue with fucking MAGA people on Calling It Now, you will be able to donate directly to the fundraiser on that show as well. So we appreciate you, Infinidale. You have been a fucking goat this week. Thank you, Fiona. Oh, wait. Where is this one? Oh, yeah. This is the one that we read before on the vertical for bleak harm reduction and decrim. Thank you, Audrey. Again, the next one I see is from Fiona. Do we have the one from Fiona next? There we go. Fiona with the $10. Thank you. Yay for wholesome callers. Best wishes, Ash. Hashtag Team Lux. Yeah. We cracking some eggs today. It was good. All in a day's work.
All right, next one. $5 from Shadow Haven. Missed calling in for doctor visits today, but wanted to share 4-month anniversary of tea. Congratulations. Best decision of my life. Happy to be alive to do it. Hashtag Team Lux.
Hell yeah. Thank you. And congratulations. Awesome. We've got another one from Legally Mod. If the screen will update. I can still read it, but there we go. Legally Mod with the $10. Thank you. Says, I read an article the other day that alleged that gender dysphoria is frequently misdiagnosed as bipolar disorder. In other news, I've got a bottom surgery date in early September. Didn't you just get FFS? Girl, you are hitting that deductible today. Like, good job on getting all that shit in 1 year.
Also, I didn't want to pressure that caller, but I got diagnosed with bipolar 2 when I was in college. And just going to say the dissociative fits were 100% dysphoria for me. And look, I'm not going to tell you that it's going to magically fix all your problems, but there is something there.
Yeah, I feel like people get misdiagnosed with bipolar a lot, like strangely often. And you and another person in the chat also said that like she was like, I resolved my bipolar disorder by transitioning. Basically, it's like misdiagnosed or just maybe the symptoms are easier to deal with, maybe. But either way, looking into misdiagnosis is important. Hubris Inc. Great name. Thank you for the 10 Canadian, who says Shrek 2 is a cinematic masterpiece. Honestly, I need to watch it again as an adult and reevaluate because I did really enjoy it as a kid, but that doesn't mean anything.
Oh, it's so good. Okay. It's so good.
Like 3 and 4,
hardcore
I don't
Shrek
remember
fan.
anything about them. So
no, 3 and 4 were terrible.
Okay.
1 and 2 were good.
Mm-hmm. Oh, this is a really sad one.
Yeah, £5 from Azza. Says Team Lux over and over, but no hashtag no vote.
No vote. Or sad Lux. Anyway, thank you, Miranda Rensberger, I think is what that says. Thank you for the $5. Who says, congratulations to all the people in chat who are celebrating transition milestones. I hope things continue to go well for all of you. Hashtag Team Lux. Fuck yeah. We love you guys.
$5 from Beaker Squeakers. Dr. Ben is the McRib of TACIS. I don't know how I feel about being a McRib. Meaty, saucy, and only here for a limited time. Hashtag Team Mina versus Team Dr. Ben is the hardest decision ever had to make. Hashtag Team Baby. So I guess it goes to you.
Hashtag Team Baby. I'll get her again.
Team
She
Baby.
didn't go far enough away the first time.
But yeah, I'm still gonna be around, just not as much. And if y'all want to still watch me do debate stuff, go follow my TikTok because I'm gonna do it there.
I went to pick her up and she actually ran away. I was like, "You're right here," and she saw me and was like, "No." Are you a good girl? You fuzzy baby. You are so fuzzy. Yes. Thank you for Sleep Near $5 who says, one last dono from Wah. Love you guys. Also, hashtag Team Mina if there's time. Yes. We got more fluffy baby.
And we got $5 from Squirrel Knitter, hashtag Team Ben. I think we already read that one. But I mean, I'll take another vote.
I don't think we did that.
Oh no, that's a different one. Okay.
Yeah, that's just a duplicate.
Disregard.
Thank you from Bramley for the $5 who says, Team whoever wants it more. I really, really, really want the vote.
But I'm behind.
Oh, that's true. Just fucking have a tie. Oh my god. Okay, you're fine.
No one gets it.
No one gets it. All right. Executive decision.
$5 from Zach Mortensen. This has been an especially informative video for me. Thank you all for everything you do. It's appreciated. Hashtag Team Lux. Thank you for sticking around, Zach.
Hell yeah. Thank you, Fern in the Forest. Whoa, I just lost it where I was at. Okay, I'll read it over here. Fern in the Forest, thank you for the $5 who says hashtag Team Lux. Just want to say you look like a gay forest elf today. Thank you all. I'm kind of generally going for a gay forest witch vibe, but I'll take elf. That's fine too.
For $5 from Bramley CX. For someone talking about the most rational direction, Cameron is being incredibly irrational. Hashtag Team Whoever Arden wants.
No one again? That would be very funny.
Ben got that one.
Okay.
Okay.
Thank you for the 5 from Melissa, who says, I just have to hear Dr. Ben say whale peen. Hashtag Team Ben.
Well, I will say whale peen, but also, speaking of whale peen, during the fundraiser this weekend, I will be in the section with Godless Engineer. So if you want us to talk about whale peen, you can show up and donate to the fundraiser too.
Yeah, I guess I'll have to show up for that because I have no fucking idea what y'all are talking about. Is it
it's a Kent Hovind thing?
Because it's it's people are like, oh, it's the Loch Ness monster, but it's actually just whale penises. They're airing them out.
I believe it was Kent Hovind, in a debate, was obsessed about the 15-foot whale peen.
Okay.
And Godless Engineer has locked onto that for several years now, and every time we play Jackbox or something, his name is Whale Peen.
Okay, that's fun. Now I know.
It's great.
Oh, Joshua Everett with the $5 who said, I would also like to hear Dr. Ben say whale peen. Hashtag Team Dr. Ben. Hashtag covering the bases.
Whale peen again. More whale peen. $5 from a Buddhist and a Jew. Hashtag Team Lux from Sean. Thanks for talking to me. I'll definitely hit up a therapist again. Thank you for your call.
Yes. Good luck out there, Sean. Thank you for the $5 from Beaker Squeakers who says, to Sean, I also have bipolar and I'm a gender nonconforming trans person. The fact I felt this way for 30 plus years tells me it's more than just the bipolar. Non-binary hearts. Hashtag Team McRib.
I'm Team McRib now, which is actually, that's really funny because I've been playing Cooking Simulator 2, and you can make your own recipes in the game, and I made a McRib and was selling people McRibs at this fancy restaurant.
That's cool.
$5 from Melatonin Ale. Hashtag Team Lux. Work interrupted the show last week and most of the show today too. At least I'll have something to watch later.
And more to watch after this. Thank you for $5 from SJL who says, the line can now legitimately say, we will control the horizontal. We will control the vertical. Hashtag outer limits for all the old people. Hashtag Team Ben.
Closing the gap. $5 from Calacia. At Hubris Inc. says, hashtag Team Lux. So now, yep, we're giving away more, giving away more votes.
Legally Mod, $5 says, I got FFS in June, boob job in September, lost most of my hair March, May. Dermatologist says it will grow back, and SRS coming up. Hashtag Team Lux. Oh, okay, yeah. It was last year you got FFS. Fuck me. God, what is time?
5 Australian from Darren. I missed the show, but here's some money. Hashtag Team Lux.
Thank you.
All right, Lux has won, so let me get that up as fast as possible because I know Lux has got to get the freak out of here.
It's true. I'm on Calling It Now with Jimmy next, talking to the MAGA people.
Okay. MAGA has queer envy. Is that what the topic is?
I think so.
Oh, yeah.
I haven't looked at the poll in a hot second.
Hey, baby girl. Oh, you want wet food? Okay. We'll do that later.
All right, so Ben is going to be defending. Host left is the winner. Here we go. All right. Charging up the clock for Dr. Ben in 3, 2, 1, go.
All right, so we all know that every accusation is a confession from MAGA. And how often do they talk about trans people and all kinds of queer people? And they do it so obsessively. Like, how many of us are sitting around thinking about the genitals that the person next to us has? Most of us are not thinking about that. And especially most of us are not thinking about these outlandish hypotheticals about, well, but what if this other person has genitals that I don't like or do like? And what if I could have genitals that I don't like or do like? And it just seems like they are thinking about this all day, every day, to the level that is very similar to how often trans people think about their gender. But the one thing MAGA doesn't have going for them is they don't have community support if they were to come out, because then they can't grift anymore, and then they can't just lazily pass policies. They can't lazily blame other people for their own problems, and that will require too much insight. So what they do instead is they just say, I hate these people, but also I hate myself. And since I hate myself, I'm also going to hate those other people. And that is that's just basically the whole premise behind MAGA in general. But we know that there are rumors, more than rumors, going around about Lindsey Graham being gay. And whether that's true or not, it seems like, it could be a distinct possibility. We do know, unfortunately, that lots of people in our government have had sexual relations inappropriately with people of all genders of varying ages, which is inappropriate, and they should not be doing that. What they should probably do is just come out and find an adult who will consent to having a gay relationship, and everything will be just much better if they did that.
So true. Very convincing.
And with that, that is the show today. Be sure to go watch Calling It Now right after this. And thank you to our mods, our call screeners, and our producers, and the patrons right there next to us. If you want to become a patron, you can become one of those names on the screen and get access to fun things like LineCon and other such events. And also, don't forget to be there for the fundraiser this weekend. If you want to be super cool, stay the entire fundraiser. Keep that browser open, keep chatting, and we'll see you all in Calling It Now.
Patreon.com